NREMT practice test bank multiple choice. Flashcard 1. Hypoglycemia and acute ischemic stroke can present similarly because both oxygen and glucose are needed for brain function. The majority of stroke patients have a history of diabetes. The most common cause of a stroke is hypoglycemia. They are both caused by low levels of glucose in the blood. Think of the answer before the reveal. The answer is both oxygen and glucose are needed for brain function. Reason: although stroke and hypoglycemia are two distinctly different conditions, their signs and symptoms are often similar. This is because the brain requires both oxygen and glucose to function normally. An acute ischemic stroke is caused by a lack of oxygen to a part of the brain due to a blocked cerebral artery, whereas hypoglycemia, low blood glucose level, deprives the entire brain of glucose. In either case, the patient presents with signs of impaired brain function, i.e., slurred speech, weakness, altered mental status. Both conditions may lead to permanent brain damage or death if not treated promptly. Flashcard 2. When dealing with an emotionally disturbed patient, you should be most concerned with gathering all of the patient's medications. Safely transporting to the hospital. Whether the patient could harm you. Obtaining a complete medical history. Think of the answer before the reveal. The answer is you selected C. This is correct. Reason: when managing any patient with an emotional or psychiatric crisis, your primary concern is your own safety. Safely transporting the patient to the hospital is your ultimate goal. If possible, you should attempt to obtain a medical history and should take any of the patient's prescribed medications to the hospital. However, this should not supersede your own safety or interfere with safely transporting the patient. Flashcard 3. You are at the scene where a man panicked while swimming in a small lake. Your initial attempt to rescue him should include rowing a small raft to the victim. Reaching for the victim with a long stick. Throwing a rope to the victim. Swimming to the victim to rescue him. Think of the answer before the reveal. The answer is you selected B. This is correct. Reason: general rules to follow when attempting to rescue a patient from the water include reach, throw, row, and then go. In this case, you should attempt to reach the victim by having him grab hold of a large stick or similar object. If this is unsuccessful, throw the victim a rope or flotation device if available. If these are not available, row to the patient in a small raft if available. Going into the water to retrieve the victim is a last resort. The rescuer must be a strong swimmer because patients who are in danger of drowning are in a state of blind panic and will make every attempt to keep themselves afloat, even if it means forcing the rescuer underwater. Flashcard 4. How should you classify a patient's nature of illness if he or she has a low blood glucose level, bizarre behavior, and shallow breathing? Behavioral emergency. Altered mental status. Respiratory emergency. Cardiac compromise. Think of the answer before the reveal. The answer is the correct answer is B. Reason: the nature of illness. NOI is the medical equivalent to mechanism of injury. Altered mental status should be the suspected NOI in any patient with any fluctuation in level of consciousness, which can range from bizarre behavior to complete unresponsiveness. Causes of an altered mental status include hypo or hyperglycemia, head trauma, stroke, behavioral crises, drug overdose, and shock, among others. Flashcard 5. A young female is unresponsive after overdosing on an unknown type of drug. Her respirations are slow and shallow and her pulse is slow and weak. Which of the following drugs is the least likely cause of her condition? Seconal. B. Heroin. C. Cocaine. D. Valium. Think of the answer before the reveal. The answer is the correct answer is C. Reason: of the drugs listed, cocaine would be the least likely cause of the patient's condition. Cocaine is a central nervous system CNS stimulant. You would expect her to be hypertensive, tachycardic, tachypneic, and perhaps even violent. Heroin, Valium, and Seconal are all CNS depressants and could explain her condition. Heroin is an illegal narcotic opiate, Valium is a benzodiazepine sedative hypnotic drug, and Seconal is a barbiturate. Narcotics, benzodiazepines, and barbiturates are all CNS depressants. When taken in excess, they cause a decreased level of consciousness, respiratory depression, bradycardia, and hypotension. Flashcard 6. Activated charcoal is contraindicated for a patient who is A:conscious and alert and has ingested a large amount of Motrin. B:emotionally upset and has ingested 2 bottles of aspirin. C:agitated and claims to have ingested a bottle of Tylenol. D:awake and alert and has swallowed a commercial drain cleaner. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: activated charcoal absorbs sticks to many ingested substances, preventing them from being absorbed into the body by the stomach or intestines. In some cases, you may give activated charcoal to patients who have ingested certain substances, if approved by medical control or local protocol. Activated charcoal is contraindicated for patients who have ingested an acid or alkali, i.e., drain cleaner, or petroleum product, i.e., gasoline, who have a decreased level of consciousness and cannot protect their own airway, or who are unable to swallow. Flashcard 7. The most obvious way to reduce heat loss from radiation and convection is to A: move away from a cold object. B: increase metabolism by shivering. C: wear a thick windproof jacket. D: move to a warmer environment. Think of the answer before the reveal. The answer is you selected D. This is correct. Reason: in a cold environment, the body has 2 ways of staying warm: generating heat thermogenesis and reducing heat loss. Radiation is the transfer of heat by radiant energy. The body can lose heat by radiation, such as when a person stands in a cold room. Convection occurs when heat is transferred to circulating air, as when cool air moves across the body's surface. A person standing in windy cold weather, wearing lightweight clothing, is losing heat to the environment mostly by convection. The quickest and most obvious way to decrease heat loss from radiation and convection is to move out of the cold environment and seek shelter from wind. Shivering increases the body's metabolism and is a mechanism for generating heat, not reducing heat loss. Layers of clothing trap air and provide excellent insulation. Thus, layered clothing decreases heat loss better than a single, thick jacket. Conduction is the direct transfer of heat from a part of the body to a colder object by direct contact, as when a warm hand touches cold metal or ice. The most obvious way to decrease heat loss by conduction is to remove your hand from the cold object. Flashcard 8. A near drowning is most accurately defined as A: complications within 24 hours following submersion in water. B: immediate death due to prolonged submersion in water. C: survival for at least 24 hours following submersion in water. D: death greater than 24 hours following submersion in water. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: collectively, drowning and near drowning are referred to as submersion injuries. Drowning is defined as death after submersion in a liquid medium, usually water. In a drowning, death is either immediate or occurs within 24 hours following submersion. Near drowning is defined as survival at least temporarily 24 hours after submersion. It should be noted, however, that complications such as pneumonia and pulmonary edema can cause death greater than 24 hours following submersion. For this reason, all patients with a submersion injury should be transported to the hospital even if they appear fine at the scene. Flashcard 9. A young woman reports significant weight loss over the last month, persistent fever, and night sweats. When you assess her, you note the presence of dark purple lesions covering her trunk and upper extremities. You should suspect a colon end-stage cancer. B. HIV/AIDS. C. Tuberculosis. D. Rheumatic fever. Think of the answer before the reveal. The answer is, you selected B. This is correct. Reason: colon weight loss, fever, and night sweats could indicate tuberculosis or HIV/AIDS. However, the dark purple lesions on the skin, which are called Kaposi's sarcoma, are malignant skin tumors and are a classic finding in patients in the later stages of AIDS. Flashcard 10. A 48-year-old male became acutely hypoxic, experienced a seizure, and is now postictal. The most effective way to prevent another seizure is to dim the lights in the back of the ambulance. B. Place him in the recovery position. C. Administer high-flow supplemental oxygen. D. Give him oral glucose if he can swallow. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: you should administer high-flow oxygen to all patients who are actively seizing and to patients who experienced a seizure and are postictal. This is especially true if the seizure was caused by hypoxia. Increasing the oxygen content of the blood, which minimizes hypoxia, may prevent another seizure. The recovery position is appropriate for uninjured patients with a decreased level of consciousness and adequate breathing. It will help maintain the airway and facilitate drainage of secretions from the mouth, but will not prevent another seizure. Oral glucose may prevent another seizure if hypoglycemia was the cause of the seizure. You should dim the lights in the back of the ambulance to help prevent any seizure, not just those that are caused by hypoxia. Flashcard 11. Which of the following conditions would be the least likely to be present in a patient who was submerged in water? A: spinal injury. B: gastric distension. C: hyperglycemia. D: laryngospasm. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: many factors can contribute to or result from a submersion injury, for example, drowning, near drowning. It is not uncommon for a person to experience a spinal injury after diving headfirst into shallow water, especially if he or she is under the influence of alcohol. When a swimmer panics, he or she initially swallows large amounts of water, resulting in gastric distension. Gastric distension can cause aspiration if the patient regurgitates water during rescue breathing. Protect the airway. During the panic phase, the victim expends a tremendous amount of energy and glucose from flailing around in the water, possibly resulting in hypoglycemia. Inhaling even a small amount of fresh or salt water can severely irritate the larynx, which sends the muscles of the larynx and vocal cords into spasm, laryngospasm, resulting in airway blockage and hypoxia. Flashcard 12. A 42-year-old male presents with fever, a severe headache, and a stiff neck. He is conscious but confused. His wife tells you that he does not have any medical problems and does not take any medications. You should be most suspicious for a: acute stroke. B: influenza. C: meningitis. D: tuberculosis. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: meningitis is an inflammation of the protective coverings of the brain and spinal cord meninges. Common signs and symptoms of meningitis include fever, headache, neck stiffness, knuckle rigidity, and vomiting. An altered mental status is common in severe cases. Meningococcal meningitis, caused by a bacterium, is the most contagious and potentially fatal type of meningitis. The patient's signs and symptoms are not consistent with acute stroke, tuberculosis (TB), or influenza the flu. Although fever is common with both TB and the flu, neither causes neck stiffness. Acute stroke may be associated with a headache, especially a hemorrhagic stroke. However, stroke patients typically do not have a fever. Flashcard 13. All of the following are signs of gastrointestinal bleeding, except A. melena, B. hematemesis, C. tachycardia, D. hemoptysis. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: signs and symptoms of gastrointestinal GI bleeding include abdominal pain, vomiting blood hematemesis, the passage of dark, tarry stools melena, and bright red rectal bleeding hematuria. If blood loss is significant, the patient may have signs of shock, for example, tachycardia, diaphoresis, tachypnea, hypotension. Hemoptysis, coughing up blood, is a sign of a pulmonary injury, not GI bleeding. Flashcard 14. A 24-year-old female presents with a rash to her left leg and swollen, painful knee joints. She tells you that she and her friends returned from a hiking trip in the mountains a week ago. She is conscious and alert with a blood pressure of 112/62 mmHg, a pulse of 84 beats/min, and respirations of 14 breaths/min. Her symptoms are most likely the result of A. Rocky Mountain spotted fever, B. Tetanus, C. Lyme disease, D. A localized allergic reaction. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: the patient's symptoms and her history of a recent hiking trip are consistent with Lyme disease, which was the result of a tick bite. Ticks can carry two infectious diseases, Lyme disease and Rocky Mountain spotted fever. Both are spread through the tick's saliva, which is injected into the skin when the tick attaches itself. The first symptom of Lyme disease, a rash that may spread to several parts of the body, begins about 3 days after the bite of an infected tick. The rash may eventually resemble a target bullseye pattern in 1/3 of patients. After a few more days or weeks, painful swelling of the joints, particularly the knees, occurs. If recognized and treated promptly with antibiotics, many patients recover completely. Rocky Mountain spotted fever, which is not limited to the Rocky Mountains, occurs within 7 to 10 days after being bitten by an infected tick. Its symptoms include nausea, vomiting, headache, weakness, paralysis, and possibly cardiopulmonary failure. Flashcard 15. A 50-year-old woman who is conscious and alert complains of a severe migraine headache. When caring for her, you should generally avoid A. transporting her in a supine position, B. shining a light into her pupils, C. dimming the lights in the ambulance, D. applying ice packs to her forehead. Think of the answer before the reveal. The answer is, you selected B. This is correct. Reason: patients with migraine or cluster headaches typically have photophobia light sensitivity. Any type of bright light, especially if shone directly into the eyes, will cause the patient with a headache unnecessary severe pain. Dimming the lights in the ambulance and making the patient as comfortable as possible are the treatments of choice for a patient with a headache. Some patients benefit from ice packs applied to the forehead. Just be sure to wrap the ice pack with roller gauze. Oxygen also should be administered as needed. Typically, the patient will prefer to lie supine or on the side. Flashcard 16. A patient who overdosed on heroin would be expected to present with A. tachycardia, B. hyperpnea, C. hypotension, D. dilated pupils. Think of the answer before the reveal. The answer is, the correct answer is C. Reason: heroin is a Schedule I illegal narcotic that is typically injected. As with all narcotics, legal or illegal, overdose causes depression of the central nervous system (CNS), resulting in a decreased level of consciousness, bradycardia, hypotension, and slow, shallow reduced tidal volume breathing. Hyperpnea, deep breathing, would not be present in a patient who overdosed on a narcotic. In a narcotic overdose, the pupils are typically constricted miosis. Barbiturates, such as phenobarbital, are also CNS depressants and cause the same symptoms seen with narcotic overdose. The patient's pupils, however, are typically dilated mydriasis, not constricted. Flashcard 17. When caring for any patient with a decreased level of consciousness, your primary concern should be the A: potential for airway compromise. B: patient's blood glucose level. C: possibility of a spinal injury. D: possibility of a drug overdose. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: altered mental status could be caused by a high or low blood glucose level, drug overdose, or head injury, among other causes. Furthermore, the possibility of a spinal injury should be considered if the patient was injured. However, your primary concern should be the status of the patient's airway. Patients with a decreased level of consciousness are at risk for aspiration if vomiting occurs. Unless spinal trauma is present or the patient is breathing inadequately, for example, fast or slow rate, shallow breathing, reduced tidal volume, place him or her in the recovery position to facilitate drainage if vomiting occurs. Remember this: no airway, no patient. Flashcard 18. A 16-year-old, 125-pound male ingested a bottle of aspirin approximately 20 minutes ago. Medical control orders you to administer activated charcoal in a dose of 1 g/kg. How much activated charcoal should you administer? A: 54 g, B: 60 g, C: 51 g, D: 57 g. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: first, you must determine the patient's weight in kilograms kg. Either of the following formulae can be used to convert pounds to kilograms. Formula 1: weight in pounds divided by 2.2 equals weight in kg. Formula 2: weight in pounds divided by 210% equals weight in kg. On the basis of the above formulae, a 125-pound patient weighs 57 kg. Using Formula 1, the equation is as follows: 125 weight in pounds divided by 2.2 equals 56.8157 rounded to the nearest tenth. Using Formula 2, the equation is as follows: 125 weight in pounds divided by 2 equals 62.563 rounded to the nearest tenth. 6.3 10% of 63 equals 56.757 rounded to the nearest tenth. Since the drug order is for 1 g/kg, you should administer 57 g of activated charcoal to your 125-pound patient. Flashcard 19. Which of the following is the most significant finding in a patient with a severe headache? A: pain in both legs, B: chest discomfort, C: unilateral weakness, D: abdominal tenderness. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: unilateral weakness on one side of the body is a clinically significant finding in a patient with a headache because it could indicate a stroke, ischemic or hemorrhagic. Abdominal, chest, and leg pain are not common complaints associated with a headache, although they should be noted and investigated if they are present. Flashcard 20. When caring for a patient with severe hypothermia who is in cardiac arrest, you should: A: perform rescue breathing only. B: perform BLS and transport. C: avoid using the AED. D: hyperventilate the patient. Think of the answer before the reveal. The answer is: the correct answer is B. Reason: patients with severe hypothermia, core body temperature 86 degrees F who are in cardiac arrest should be managed with basic life support, chest compressions and ventilations, passive external rewarming, i.e., removal of wet clothing, applying warm blankets, and rapid transport to the hospital where they can be actively rewarmed. Because cold muscle is a poor conductor of electricity, defibrillation, if indicated, should be limited to one attempt until the patient's body temperature has been increased. Cardiac arrest patients with severe hypothermia generally do not respond to defibrillation. Hyperventilation should be avoided as this may increase intrathoracic pressure and impair blood flow back to the heart. Flashcard 21. You should not attempt to actively rewarm a patient with moderate or severe hypothermia in the field because a colon rewarming too quickly can cause a fatal cardiac dysrhythmia. B. The risk of inadvertently inducing hyperthermia is too high. C. It is painful for the patient and you cannot give analgesic drugs. D. Active rewarming has been shown to cause severe hypertension. Think of the answer before the reveal. The answer is, you selected A. This is correct. Reason: when caring for a patient with hypothermia, your goal is to prevent further heat loss. This involves removing wet clothing, applying warm blankets, and allowing the patient's body temperature to rise gradually and naturally. Passive rewarming. If the patient is moderately or severely hypothermic, you should not try to rewarm him or her actively placing heat on or into the body. Rewarming too quickly may cause a fatal cardiac dysrhythmia, such as ventricular fibrillation (VFib). Active rewarming may also cause rewarming shock, a condition in which the blood vessels dilate when heat is applied to the body, resulting in significant hypotension. For these reasons, active rewarming should only be performed in the controlled setting of a hospital. Flashcard 22. You respond to a grocery store where a 39-year-old man reportedly experienced a seizure. When you arrive at the scene, a clerk begins to escort you to the patient. She tells you that the man stopped seizing about 5 minutes ago. If the patient truly experienced a seizure, you will most likely find that he has a slow heart rate. B. Is fully conscious and alert. C. Is not breathing and is cyanotic. D. Is confused and disoriented. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: most seizures are followed by a postictal phase, in which the patient is unresponsive at first and then gradually regains consciousness. In most cases, the postictal patient appears dazed, confused, or disoriented. In some cases, he or she is combative. The postictal phase typically lasts from 5 to 30 minutes. During the seizure, the patient is often not breathing or is breathing inadequately. However, when the seizure stops, breathing usually resumes. You will also find that most postictal patients are tachycardic. This is the result of an adrenaline surge that occurs during the tonic-clonic phase of the seizure. Flashcard 23. You are called to a local park for an ill person. It is a hot day and the humidity is high. When you arrive, a bystander directs you to the patient, a young male who is semi-conscious. His skin is flushed, hot, and moist. Your first action in the management of this patient should be to begin rapid cooling measures. B. Ensure an open airway. C. Administer high-flow oxygen. D. Move him to a cool area. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: your first action in a heat-related emergency is to move the patient to a cooler environment. Once you have moved the patient to a cooler place, you should begin your assessment and treat the patient accordingly. Remember, you must first prevent further harm to the patient. Flashcard 24. A known diabetic female is found unresponsive. Her respirations are rapid and shallow. Her skin is cool, clammy, and pale, and her pulse is rapid and weak. Which of the following would best explain the likely cause of her condition? A: failure to take insulin. B: insulin overdose. C: excessive eating. D: high blood sugar. Think of the answer before the reveal. The answer is, the correct answer is B. Reason: the patient has classic signs of insulin shock, a condition caused by a low blood glucose level, hypoglycemia. Common causes of insulin shock include insulin overdose, accidental or intentional, failure to eat or not eating enough, and excessive exertion. The patient's symptoms are not consistent with diabetic ketoacidosis (DKA), a condition that results from a high blood glucose level hyperglycemia. Signs of DKA include deep, rapid breathing with a fruity or acetone breath, odor, cusmo respirations, and warm, dry skin. Unlike insulin shock, which can result from an insulin overdose, DKA can occur if a patient fails to take his or her insulin or takes too little. Flashcard 25. You are dispatched to a residence for a 20-year-old male with respiratory distress. When you arrive, you find that the patient has a tracheostomy tube and is ventilator dependent. His mother tells you that he was doing fine, but then suddenly began experiencing breathing difficulty. You should: detach the ventilator, suction the tracheostomy tube, and reassess the patient. Remove the ventilator tubing and place an oxygen mask over the tracheostomy tube. Remove him from the mechanical ventilator and ventilate him manually. Check the settings on the ventilator to ensure that it is functioning properly. Think of the answer before the reveal. The answer is you selected C. This is correct. Reason: if a ventilator-dependent patient experiences a sudden onset of respiratory distress, you should first remove him or her from the mechanical ventilator and begin manual ventilation with a bag mask device. If the patient improves, you will know that the problem was a malfunction with the mechanical ventilator. If the patient does not improve, the tracheostomy tube is likely plugged with thick mucus secretions and requires suctioning. Unless you are familiar with a mechanical ventilator, most EMTs are not. Do not attempt to troubleshoot the device by checking the settings. This only wastes time. Flashcard 26. A middle-aged man was found floating face down in a small pond. When you arrive at the scene, bystanders are present, but nobody has removed him from the water because they thought he was dead. After reaching the victim, you should: float a buoyant backboard under him, remove him from the pond, and begin rescue breathing. Move him to a supine position by rotating the entire upper half of his body as a single unit. Stabilize his head as you remove it from the water and open his airway by tilting his head back. Grab him by his clothing, remove him from the pond, and assess for breathing and a pulse. Think of the answer before the reveal. The correct answer is B. Reason: after safely reaching a drowning victim, you should first turn him to a supine position by rotating the entire upper half of the body as a single unit. Protect the cervical spine as you do this, because a spinal injury cannot be ruled out. Open the patient's airway without manipulating the neck, and begin rescue breathing while still in the water. Float a buoyant backboard under the patient, secure him to it, and remove him from the water. After removing the victim from the water, assess for a pulse. If the victim is pulseless, begin CPR, dry him off, and apply the AED as soon as possible. Flashcard 27. Which of the following patients with diabetes is the best candidate for oral glucose? A confused patient who has cool, clammy skin. B: a semi-conscious patient with pale, clammy skin. C: an unresponsive patient who took too much insulin. D: a confused patient with suspected hyperglycemia. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: oral glucose is indicated for patients with diabetes who are in insulin shock hypoglycemic crisis, or for any patient with symptomatic hypoglycemia as documented by glucometer. The patient must be conscious and alert enough to be able to swallow the glucose, which comes in a tube of gel. If the patient is unresponsive or otherwise unable to swallow the glucose, you should provide rapid transport, providing the appropriate airway management en route, and consider an ALS intercept. Flashcard 28. A 40-year-old woman presents with widespread hives that she noticed about 45 minutes after taking penicillin. She is conscious and alert and denies difficulty breathing. Her breath sounds are clear to auscultation bilaterally, her vital signs are stable, and her oxygen saturation is 94%. She tells you she is allergic to wasps and has an epinephrine autoinjector. You should: assist her in administering epinephrine via her autoinjector. B: give high-flow oxygen and administer 100 mg of Benadryl. C: give supplemental oxygen and transport her to the hospital. D: advise her that she can probably drive herself to the hospital. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: the patient is experiencing an allergic reaction, but she is not in anaphylactic shock. Urticaria hives is common to all allergic reactions, regardless of severity. However, wheezing and hypotension, which she does not have, are specific to anaphylaxis. Although she carries an epinephrine auto-injector for her allergy to wasps, she was not stung by a wasp. Furthermore, the absence of wheezing and hypotension negates epinephrine administration. Give supplemental oxygen in a concentration sufficient to maintain an SpO2 of greater than 94% and transport her to the hospital. Because it can take up to an hour for signs of a severe allergic reaction to manifest, the patient should not drive herself. Diphenhydramine Benadryl, an antihistamine, is an appropriate drug based on her presentation. However, it is not typically carried on a BLS unit. Furthermore, the correct dose is 25 to 50 mg. Flashcard 29. Immediately following a generalized motor seizure, most patients are A: hyperactive, B: confused, C: apneic, D: awake and alert. Think of the answer before the reveal. The answer is, you selected B. This is correct. Reason: after a generalized grand mal motor seizure, the patient typically will be confused, sleepy, or in some cases combative. This is referred to as the postictal phase. The patient's level of consciousness typically improves within 30 minutes. In many cases, the patient's respirations will be fast tachypnea following a seizure. This is the body's attempt to eliminate excess carbon dioxide that accumulated in the blood during the seizure. Flashcard 30. When assessing a conscious patient who overdosed on a drug, you should first determine A: if there is a history of prior overdose, B: the patient's weight in kilograms, C: the type of medication ingested, D: when the medication was ingested. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: when assessing a patient who has overdosed on a drug, you should first determine what was ingested, which will provide you with immediate information about whether or not the substance is toxic. You should then find out when the medication was ingested. This information will provide medical control or poison control with the information needed to direct the most appropriate treatment. The patient's weight also should be estimated in kilograms in the event that an antidote is required. Information regarding prior drug overdoses would normally be obtained during the sample history. Flashcard 31. Which of the following actions should be carried out during the primary assessment of an unresponsive patient? A: assessing the skin, B: obtaining a blood pressure, C: palpating the cranium, D: auscultating the lungs. Think of the answer before the reveal. The answer is, you selected A. This is correct. Reason: components of the primary assessment for both responsive and unresponsive patients include assessing and managing the airway and assessing and managing circulation, which includes controlling any major bleeding, assessing the rate, regularity, and quality of the pulse, and assessing the color, condition, and temperature of the skin. Flashcard 32. When restraining a violent patient, you should make sure that A: the patient is restrained using maximal force, B: at least 2 EMTs restrain the patient, C: consent for restraint has been obtained from a family member, D: someone talks to the patient during the process. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: if a violent patient needs to be restrained, you must ensure the presence of at least 4 people, 1 per extremity. One of the EMTs should continuously talk to the patient to explain what is happening, even if the patient is not listening. Restraint is a last resort used to protect the EMT as well as the patient. Consent is not needed from a family member prior to restraining the patient. Just enough force to effectively restrain the patient is all that is required to prevent causing unnecessary injury. Flashcard 33. Immediately following a generalized seizure involving tonic-clonic activity, most patients, have a slow heart rate because of cardiac depression during the seizure. Are unresponsive but gradually regain consciousness. C: experience prolonged apnea and require positive pressure ventilations. D: return to a normal level of consciousness but cannot recall the event. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: most generalized grand mal seizures last 3 to 5 minutes and are followed by a lengthy 5 to 30 minutes period called the postictal phase, in which the patient is unresponsive at first but gradually regains consciousness. During the seizure itself, the nervous system releases excess adrenaline epinephrine. Therefore, tachycardia, even after the seizure has stopped, is common. Apnea is common during a seizure. However, breathing usually resumes after the seizure has stopped. Many patients are tachypneic following a seizure. This is the body's attempt to eliminate excess carbon dioxide that accumulated in the blood during the seizure. Unlike grand mal seizures, petit mal seizures, also called absence seizures, can last for just a fraction of a minute, after which the patient fully recovers immediately with only a brief lapse of memory of the event. Flashcard 34. Which of the following organs are contained within the right upper quadrant of the abdomen? A: liver and gallbladder. B: stomach and gallbladder. C: liver and spleen. D: liver and stomach. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: the liver and gallbladder lie within the right upper quadrant of the abdomen. Most of the stomach is within the left upper quadrant, as is the entire spleen. Flashcard 35. You respond to a baseball field for a person who is struck by lightning. When you arrive, you see one patient who appears confused and is ambulatory, a second patient who is conscious, sitting on the ground and holding his arm, and a third patient who is supine and motionless. After requesting additional responders, you should assess the motionless victim and perform CPR and defibrillation if necessary. B: assess and begin treating the sitting patient first because he is obviously injured. C: treat the conscious patients because the motionless patient is likely deceased. D: proceed to the ambulatory patient, sit him down, and assess his mental status. Think of the answer before the reveal. The answer is: you selected D. The correct answer is A. Reason: the process of triaging multiple victims of a lightning strike is different than the conventional triage methods used during a mass casualty incident. When a person is struck by lightning, respiratory or cardiac arrest, if it occurs, usually occurs immediately. Those who are conscious following a lightning strike are much less likely to develop delayed respiratory or cardiac arrest. They usually survive. Therefore, you should focus your efforts on those who are in respiratory or cardiac arrest. This process, called reverse triage, differs from conventional triage, where such patients would ordinarily be classified as deceased. Flashcard 36. A 32-year-old man who is stunned by a bee has diffuse hives, facial swelling, and difficulty breathing. When he breathes, you hear audible stridor. What does this indicate? A: narrowing of the two mainstem bronchi. B: swelling of the upper airway structures. C: narrowing of the bronchioles in the lungs. D: swelling of the lower airway structures. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: this patient is experiencing a severe allergic reaction, anaphylaxis. Stridor, which is a high-pitched sound heard on inhalation, indicates swelling of the structures and tissues of the upper airway. If not promptly treated, the patient's airway may close completely, resulting in respiratory arrest. Narrowing of the bronchioles in the lungs causes wheezing, a whistling sound that may be heard during inhalation, exhalation, or both. Flashcard 37. A behavioral crisis is most accurately defined as any reaction to an event that interferes with the activities of daily living or has become unacceptable to the patient, family, or community. An acute psychiatric emergency characterized by violent behavior, mood swings, and a loss of connection to reality. A persistent feeling of sadness, despair, or hopelessness that incapacitates the patient and prevents him or her from interacting socially. A chronic mental health problem in which the patient experiences frequent thoughts of suicide or other self-destructive behavior. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: the definition of a behavioral crisis or emergency is any reaction to an event that interferes with the activities of daily living, for example, bathing, dressing, eating, or has become unacceptable to the patient, his or her family, or the general community. Some patients react to an event with violent behavior or suicidal thoughts. Others react with depression. Regardless of the reaction, it significantly interferes with the patient's life or is unacceptable to his or her family and/or the community. Flashcard 38. You are called to an assisted living center where an attendant found a 72-year-old man unresponsive. The patient had recent hip surgery and has been taking Vicodin for pain. His respirations are slow and shallow and his pulse is slow and weak. You should apply the AED in case he develops cardiac arrest. Request an ALS ambulance to respond to the scene. Begin ventilation assistance with a bag mask device. Apply high-flow oxygen via a non-rebreathing mask. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: Vicodin is a combination of hydrocodone and acetaminophen, the active ingredient in Tylenol. Hydrocodone is a potent narcotic analgesic. When taken in excess, it can suppress the central nervous system and cause respiratory depression, bradycardia, and hypotension. Initial management of any patient who has overdosed on a medication of this type is to ensure a patent airway and support breathing. Because the patient is breathing inadequately slow and shallow, immediate ventilation assistance is needed. Consider requesting an ALS ambulance if transport time to the nearest hospital will be lengthy. Paramedics can administer a drug called naloxone Narcan to reverse the effects of narcotic drugs. The AED is not indicated for this patient. It is only applied to patients in cardiac arrest. Flashcard 39. In the patient with diabetes, insulin shock typically presents with clammy skin and a rapid onset. Dry skin and a slow onset. Dry skin and a rapid onset. Clammy skin and a slow onset. Think of the answer before the reveal. The answer is: the correct answer is A. Reason: in the patient with diabetes, insulin shock hypoglycemic crisis presents with cool, clammy skin and a rapid onset. The brain is critically dependent on glucose and responds quickly when the body is in short supply. Diabetic coma hyperglycemic crisis typically presents with warm, dry skin and a slow onset, sometimes occurring over a period of days. Flashcard 40. Your first action in managing a patient with an altered mental status should be to determine if the patient is breathing adequately. Administer 1 tube of oral glucose. Administer high-flow supplemental oxygen. Ask a family member how the patient normally acts. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: when treating a patient with an altered mental status, you must first ensure a patent airway and determine if the patient is breathing adequately. If the patient is breathing adequately, administer supplemental oxygen and continue your assessment. If the patient is not breathing adequately, i.e., fast or slow rate, shallow breathing, reduced tidal volume, assist his or her ventilations. It is important to ask a family member, if available, how the patient normally acts. This will help establish a baseline. Before administering oral glucose, you should assess the patient's blood glucose level to determine if hypoglycemia is the cause of his or her problem, and then decide if the patient is able to swallow the glucose, if indicated. If the patient is unable to swallow, do not administer oral glucose, even if he or she is hypoglycemic. Request a paramedic ambulance if possible so the patient can receive intravenous glucose. Flashcard 41. A patient who overdosed on methamphetamine would be expected to have all of the following clinical signs, except A: agitation, B: hypertension, C: dilated pupils, D: bradycardia. Think of the answer before the reveal. The answer is: you selected C. The correct answer is D. Reason: methamphetamine, an upper, stimulates the central nervous system, causing it to release excessive amounts of adrenaline epinephrine. Epinephrine increases heart rate and blood pressure. Therefore, the patient would experience tachycardia and hypertension. Other signs of methamphetamine overdose, which also indicate an adrenaline surge, include pupillary dilation, agitation, and hyperthermia. Bradycardia would be expected in patients who have overdosed on drugs that suppress, not stimulate, the central nervous system, for example, narcotics, benzodiazepines, barbiturates. Flashcard 42. A 50-year-old woman with a history of epilepsy is actively seizing. Care for this patient should focus primarily on A: protecting her from injury and ensuring adequate ventilation, B: administering high-flow oxygen and requesting an ALS ambulance, C: frequently suctioning her airway and carefully restraining her, D: placing a bite block in between her molars and giving her oxygen. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: seizure deaths are most frequently the result of hypoxia. When a person is actively seizing, he or she is not breathing adequately. Your primary focus when treating a seizure patient is to protect him or her from injury and to ensure adequate ventilation and oxygenation. Many seizing patients require assisted ventilation. Suction the oropharynx only if the patient has secretions in his or her mouth. Do not insert anything into the mouth of a seizing patient. Doing so may cause an airway obstruction or damage the soft tissues of the mouth, resulting in bleeding. Do not attempt to restrain an actively seizing patient. Doing so may result in musculoskeletal injuries. Request an ALS ambulance per your local protocols. Flashcard 43. When you arrive at a residence for a man who is not acting right, you enter the house and find him sitting on his couch. Which of the following findings would be most indicative of an altered mental status? A: slurred speech, B: tired appearance, C: odor of alcohol, D: eyes are closed. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: often, an altered mental status can be difficult to assess, especially if you do not know how the patient normally acts. However, there are key findings that should increase your index of suspicion. An abnormal speech pattern, such as slurring or incoherent words, can be the result of a diabetic problem, alcohol intoxication, or drug ingestion. All of these can cause an altered mental status. The odor of alcohol suggests intoxication as a potential cause of his problem, but cannot be quantified. Just because the patient's eyes are closed or he has a tired appearance does not necessarily indicate that he has an altered mental status. Flashcard 44. Hypoxia-induced unresponsiveness during a submersion injury is usually the result of A: a cardiac dysrhythmia, B: associated hypothermia, C: laryngospasm, D: water in the lungs. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: When a patient falls into the water or becomes panicked when in the water, he or she begins to swallow large amounts of water. Even a small amount of water near the larynx can cause a spasm, which closes off the airway. This results in hypoxia, loss of consciousness, and cardiac dysrhythmias. If the patient is not removed from the water at once and treated aggressively, hypoxia and acidosis will eventually result in cardiac arrest. Flashcard 45. Which of the following conditions would most likely cause flushed skin? A: low blood pressure, B: blood loss, C: hypothermia, D: exposure to heat. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: whenever the body temperature rises, i.e., heat exposure, fever, the peripheral blood vessels dilate, which draws warm blood to the skin and gives it a flushed red appearance. Blood loss, shock, low blood pressure, hypotension, and hypothermia generally cause the skin to become pale. These conditions cause peripheral vasoconstriction, which shunts blood away from the skin. Flashcard 46. Which of the following mechanisms cause respiratory and circulatory collapse during anaphylactic shock? A: bronchodilation and vasodilation, B: bronchoconstriction and vasoconstriction, C: bronchoconstriction and vasodilation, D: bronchodilation and vasoconstriction. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: during anaphylaxis, histamines released from the immune system cause two negative effects that result in shock hypoperfusion: vasodilation, which causes the blood pressure to fall, and bronchoconstriction, which impairs breathing. Flashcard 47. A 50-year-old female complains of severe pain to the right lower quadrant of her abdomen. You should: A: palpate the left upper quadrant of her abdomen first. B: keep her supine with her legs fully extended. C: quickly palpate that area first to assess for rigidity. D: suspect that she has an acute problem with her liver. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: when assessing a patient with abdominal pain, determine where the pain is most severe, in this case, the right lower quadrant, and then palpate the quadrant furthest from that area first, in this case, the left upper quadrant. If you palpate the painful area first, the patient is less likely to allow you to assess the remainder of his or her abdomen. It also causes the patient unnecessary pain. Pain to the right lower quadrant suggests a problem with the appendix, for example, appendicitis, not the liver. Patients with abdominal pain commonly prefer to lie on their side with their legs drawn into their abdomen. This position often provides pain relief by taking pressure off of the abdominal muscles. If the patient prefers this position, do not discourage it. Flashcard 48. A 30-year-old man with a history of schizophrenia cut his wrists and is bleeding profusely. He is confused, combative, and has slurred speech. With the assistance of law enforcement personnel, you and your partner physically restrain him in order to provide care and transport. In this situation, a court of law would most likely: A: conclude that you should have had a court order to restrain. B: determined that the patient had decision-making capacity. C: agree that you and your partner are guilty of assault and battery. D: consider your actions in providing care to be appropriate. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: an adult with decision-making capacity, i.e., a mentally competent adult, has the legal right to refuse medical treatment, even if that treatment involves life-saving care. In psychiatric cases, however, a court of law would likely consider your actions in providing life-saving care to be appropriate, particularly if you have a reasonable belief that the patient would harm him or herself or others without your intervention. In addition, a patient who is in any way impaired, whether by mental illness, medical condition, or intoxication, may not be considered competent to refuse treatment and transport. If you are unsure of a patient's decision-making capacity, err on the side of treatment and transport. Few would argue that it would be easier to defend why you treated a patient than to justify or defend why you abandoned a patient. Flashcard 49. After removing a patient from the water, your assessment reveals that he is not breathing and is continuously regurgitating large amounts of water. You should perform abdominal thrusts to remove the water. Begin rescue breathing after he stops regurgitating. Alternate suctioning with artificial ventilations. Place him on his side and press on his abdomen. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: in cases where a patient is not breathing and is regurgitating passively vomiting secretions at the same time, you must address both issues. This is accomplished most effectively by suctioning for 15 seconds and then ventilating for 2 minutes. This alternating sequence should be repeated until all secretions are cleared from the airway. You should turn the patient onto his side to facilitate drainage of liquid, but do not apply pressure to his abdomen. Manual gastric decompression, which involves applying pressure to the patient's abdomen, is a dangerous maneuver because it will force more water from the stomach, which the patient could potentially aspirate. Manual gastric decompression should only be performed if gastric distension is so severe that it is impossible to ventilate a patient and a paramedic is not present to insert a gastric tube into the stomach. Abdominal thrusts are used to remove a solid foreign body from the airway, not liquid. Flashcard 50. Approximately 5 minutes after being stung by a bee, a 21-year-old male develops hives and begins experiencing difficulty breathing. When you arrive at the scene, you note that his level of consciousness is decreased, his breathing is labored, and wheezing can be heard without a stethoscope. The patient has a bee sting kit but has not used it. You should give him high-flow oxygen via a non-rebreathing mask, cover him with a blanket and elevate his legs, and assist him in swallowing the antihistamine tablets that are in his bee sting kit. Provide positive pressure ventilations, initiate rapid transport, and coordinate a rendezvous with the paramedic unit, so they can administer the epinephrine from his bee sting kit. Assist his ventilations with a bag mask device, administer epinephrine from his bee sting kit after receiving approval from medical control, and prepare for immediate transport. Administer high-flow oxygen via a non-rebreathing mask, apply a chemical cold pack to the sting, transport at once, and be prepared to administer the epinephrine from his bee sting kit. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: the patient is in anaphylactic shock and needs epinephrine immediately. Epinephrine is given to patients with anaphylactic shock because it constricts the blood vessels and dilates the bronchioles, thus improving perfusion and breathing. Begin assisting his ventilations with a bag mask device. His breathing is inadequate, for example, decreased LOC, wheezing, labored breathing. After receiving permission from medical control, give the epinephrine from his bee sting kit on a kit via intramuscular injection and transport at once. Some EMS protocols may not require you to contact medical control before giving epinephrine to a patient whose condition is critical. Ordinarily, you would instruct the patient to chew and swallow the antihistamine tablets after giving epinephrine. However, the patient's level of consciousness contraindicates placing anything in his mouth. Flashcard 51. Which of the following signs is least suggestive of a diabetic emergency? A: fruity breath, odor; B: bradycardia; C: combativeness; D: tachycardia. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: bradycardia is not commonly associated with either hyperglycemia or hypoglycemia. Tachycardia and combativeness can occur in patients with hyperglycemia or hypoglycemia. A fruity breath odor is noted exclusively in patients with diabetic ketoacidosis, diabetic coma, hyperglycemic crisis. Flashcard 52. A 46-year-old man presents with generalized weakness and shortness of breath after he was bitten on the leg by a rattlesnake. His blood pressure is 106/58 mmHg and his pulse rate is 112 beats/min. In addition to supplemental oxygen, further treatment for this patient should include A: ice packs to the wound and splinting. B: proximal arterial constricting band and splinting. C: splinting and lowering of the affected part. D: elevation of the affected part and ice packs. Think of the answer before the reveal. The answer is. The correct answer is C. Reason: care for a patient with a bite from a pit viper, rattlesnake, copperhead, water moccasin includes keeping the patient calm, administering supplemental oxygen, splinting the affected part, and keeping it below the level of the heart. Do not apply ice to a snake bite. This will cause local vasoconstriction and may force the venom deeper into the patient's circulation. If a constricting band is applied, it should be proximal to the bite and should be tight enough to slow venous return only, not cut off arterial supply. Flashcard 53. Which of the following is a later sign of hepatitis? A: fever and vomiting. B: jaundice. C: loss of appetite. D: fatigue. Think of the answer before the reveal. The answer is. You selected B. This is correct. Reason: early signs and symptoms of viral hepatitis include loss of appetite, anorexia, vomiting, fever, fatigue, and muscle and joint pain. Jaundice, yellow sclea, and skin and right upper quadrant abdominal pain are not common early manifestations of hepatitis. They usually develop within 1 to 2 weeks into the disease process. Flashcard 54. A 60-year-old male complains of a tearing sensation in his abdomen. He tells you the pain began suddenly and feels like someone is sticking a knife into his abdomen. He is conscious and alert with a blood pressure of 148/88 mmHg, a pulse of 120 beats/min, and respirations of 22 breaths/min. In addition to administering high-flow oxygen, you should A: perform a rapid head-to-toe assessment and prepare for transport. B: auscultate over his epigastrium to assess for bowel sounds. C: vigorously palpate his abdomen to assess for pulsating mass. D: transport at once and be prepared to treat him for severe shock. Think of the answer before the reveal. The answer is. The correct answer is D. Reason: given the onset and nature of the patient's pain, for example, sudden onset, tearing sensation, you should suspect that he has an acute dissection of the abdominal aorta. Administer high-flow oxygen and transport him at once. Acute aortic dissection can quickly cause an aneurysm, which could rupture and cause profound shock. Therefore, you must carefully monitor him and be prepared to treat him accordingly. Unnecessary or vigorous palpation of his abdomen could cause his aorta to rupture and should be avoided. A rapid head-to-toe assessment is indicated for trauma patients with a significant mechanism of injury and unresponsive medical patients. This patient falls into neither of these categories. Auscultating bowel sounds in the field is time-consuming, will yield little information, and only delays transport. Flashcard 55. Which of the following statements regarding the function of insulin is correct? A: it stimulates the liver to release glucose into the bloodstream. B: it facilitates the uptake of glucose from the bloodstream into the cell. C: it causes the pancreas to produce glucose based on the body's demand. D: it promotes the entry of glucose from the cell into the bloodstream. Think of the answer before the reveal. The answer is. You selected B. This is correct. Reason: insulin is a hormone produced by the beta cells in the islets of Langerhans of the pancreas. It promotes the uptake of glucose from the bloodstream into the cells where it is used in the production of energy. Glucagon, a hormone produced by the alpha cells in the pancreas, facilitates the conversion of glycogen to glucose glycogenolysis in the liver. The liver does not produce glucose, it produces glycogen, a complex sugar that the body cannot utilize until it has been converted to glucose, a simple sugar. Flashcard 56. A 72-year-old woman is found unresponsive in her poorly ventilated home. Her skin is flushed, hot, and dry, and her respirations are rapid and shallow. She is wearing a medical alert bracelet that states she is a diabetic and is allergic to sulfa drugs. You should be most suspicious for A: acute ischemic stroke, B: a diabetic complication, C: heat stroke, D: anaphylactic shock. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: the patient's signs and symptoms are consistent with classic heat stroke. Unlike exertional heat stroke, which usually affects otherwise healthy people who exert themselves in the heat for long periods of time, classic heat stroke commonly affects children and older adults, and typically occurs when the patient is in a hot, poorly ventilated space for a prolonged period of time. Significant underlying medical problems, for example, hypertension, diabetes, heart disease, increase the patient's risk for classic heat stroke. Both exertional and classic heat stroke present with hot, flushed skin. However, patients with exertional heat stroke may have moist skin, usually from residual perspiration, whereas patients with classic heat stroke typically have dry skin. Flashcard 57. A 36-year-old male who is a known diabetic presents with severe weakness, diaphoresis, and tachycardia. He is conscious but confused. His blood pressure is 110/58 mmHg, pulse is 120 beats/min and weak, and respirations are 24 breaths/min. The glucometer reads error after several attempts to assess his blood glucose level. In addition to high-flow oxygen, medical control will most likely order you to A: transport only and closely monitor him. B: assist the patient in taking his insulin. C: give him a salt-containing solution to drink. D: give at least 1 tube of oral glucose. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: the patient's signs and symptoms indicate hypoglycemia. When you are in doubt as to a patient's blood glucose level, you should err on the side of caution and give sugar. This is what medical control will likely order you to do. The patient, although confused, is conscious and will likely be able to swallow. Insulin is not administered to patients in the field. Even if hyperglycemia is documented, EMTs and paramedics are usually not familiar with all of the different types of insulin and their respective doses, and profound hypoglycemia, potentially resulting in death, can occur if too much insulin is given. After giving oral glucose, reassess the patient's mental status and vital signs. Flashcard 58. After moving a hypothermic patient to a warmer area, your primary focus should be to A: prevent further body heat loss. B: provide rapid rewarming. C: assess his or her body temperature. D: give warm, humidified oxygen. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: after moving a hypothermic patient to a warmer area, your primary focus should be to prevent further body heat loss. Remove wet or damp clothing and cover the patient with blankets. Passive rewarming. It is especially important to cover the patient's head. Most heat is lost around the head and neck. You should not, however, try to actively rewarm the patient, i.e., placing heat on or into the body. Rewarming too quickly may induce a lethal cardiac dysrhythmia and cardiac arrest. For this reason, active rewarming should be done in the controlled setting of a hospital. In some areas, medical control may call for the administration of warm, humidified oxygen. Follow your local protocols. Assessing a hypothermic patient's core body temperature requires a special hypothermia thermometer, which many EMS systems do not carry. Flashcard 59. Rapid transport of a patient who ingested a large dose of Tylenol is important because it only takes a small dose of Tylenol to cause cardiopulmonary arrest. B: liver failure usually occurs within 6 hours following a Tylenol overdose. C. An antidote may prevent liver failure if administered early enough. D. Activated charcoal cannot be given to patients who ingested Tylenol. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: acetaminophen, the active ingredient in Tylenol, is a safe drug if taken as directed. However, ingestion of more than 140 mg/kg in an adult can cause liver failure and death. Symptoms of a PAP overdose do not present acutely. It can take up to a week before signs of liver failure are apparent. The antidote for acetaminophen poisoning is acetylcysteine acetato, Mucomist, which is only given at the hospital. However, it must be given promptly if liver failure is to be avoided. Activated charcoal can be given to patients with a PAP overdose. However, it is only effective if the drug is still in the stomach. After 1 to 2 hours following ingestion, activated charcoal would likely be ineffective. Flashcard 60. Which of the following structures is responsible for regulating body temperature? A: cerebrum, B: medulla oblongata, C: hypothalamus, D: cerebellum. Think of the answer before the reveal. The answer is, you selected B. The correct answer is C. Reason: the hypothalamus, which is located within the brainstem, regulates body temperature by acting as the body's thermostat. During a heat-related emergency, the hypothalamus can reset the body's normal temperature to a much higher temperature in response to the environment and the body's inability to eliminate heat. Flashcard 61. A young male experienced a syncopal episode after working in the heat for several hours. He is conscious and alert, has cool, clammy skin, and complains of nausea and lightheadedness. You should: A: provide rapid cooling. B: give him cold water to drink. C: advise him to go home and rest. D: transport him on his side. Think of the answer before the reveal. The answer is, the correct answer is D. Reason: the patient is experiencing heat exhaustion and should be transported to the hospital for evaluation, especially since he experienced a syncopal episode fainting. Because he is nauseated, he should not be given anything to drink and should be placed on his side during transport to prevent aspiration if he vomits. Loosen any restrictive clothing that may trap heat. Rapid cooling is indicated for patients with heat stroke, the signs of which include an altered mental status and hot, flushed skin, dry or moist. Flashcard 62. Which of the following is a physiologic effect of epinephrine when used to treat anaphylactic shock? A: as a vasodilator, it increases the blood pressure. B: as an antihistamine, it blocks chemicals that cause the reaction. C: as a vasoconstrictor, it lowers the blood pressure. D: as a bronchodilator, it improves the patient's breathing. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: epinephrine possesses dual effects. As a bronchodilator, it relaxes the smooth muscle of the bronchioles and improves the patient's breathing. As a vasoconstrictor, it constricts the blood vessels and increases the patient's blood pressure. Diphenhydramine Benadryl is an antihistamine. It blocks H1 histamine receptor sites, which blocks the release of the chemicals histamines that are causing the allergic reaction. Flashcard 63. A 73-year-old male presents with confusion, cool, pale, clammy skin, absent radial pulses, and a blood pressure of 70/40 mmHg. The patient's wife tells you that he has had abdominal pain for a week and began vomiting a coffee ground substance yesterday. His past medical history includes hypertension and gastric ulcer disease. Your most immediate concern should be that, A: he is bleeding from his gastrointestinal tract. B: he is in shock and requires prompt transport. C: his blood glucose level is probably too high. D: his condition requires surgery within 2 hours. Think of the answer before the reveal. The answer is, you selected B. This is correct. Reason: the patient is likely bleeding from his gastrointestinal GI tract. Although this is a serious condition, it is not a condition you can treat. Internal bleeding cannot be controlled in the field. You can, however, treat his signs and symptoms of shock by administering high-flow oxygen and keeping him warm by covering him with a blanket. Therefore, this should be your most immediate concern. Furthermore, the patient requires prompt transport to the hospital where he can receive definitive care, which may or may not involve surgery. It is highly unlikely that his blood glucose level is too high. He does not have a history of diabetes. Flashcard 64. The two most important steps in treating a patient with a contact poisoning are determining when the exposure occurred and irrigating the patient's entire body with copious amounts of water. Avoiding self-contamination and removing the irritating or corrosive substance from the patient as rapidly as possible. Donning a pair of gloves and performing a physical examination to determine if a significant exposure occurred. Immediately washing any dry chemicals off of the patient's skin and removing his or her clothing as soon as possible. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: when caring for a patient with a contact skin surface exposure to a poison, the two most important steps in management are avoiding contaminating yourself and removing the substance from the patient's skin as rapidly as possible. The level of personal protective equipment (PPE) you use depends on the type of chemical the patient was exposed to. After ensuring your own safety, remove all of the patient's clothing that has been contaminated, thoroughly brush off any dry chemicals, and then flush the skin with water. Always brush dry chemicals off the skin before irrigating with water. Failing to do so may increase the amount of damage caused by the chemical. A physical exam of the patient should be performed only after he or she has been properly decontaminated. Flashcard 65. A 28-year-old woman has severe lower quadrant abdominal pain. When assessing her abdomen, you should encourage the patient to lie supine with her legs fully extended. Ask her where the pain is located and palpate that area first. Auscultate for bowel sounds for approximately 2 to 5 minutes. Ask her where the pain is located and palpate that area last. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: assessment of a patient's abdomen includes asking where the pain is located and then palpating that area last. Palpating the painful area first may interfere with the rest of your assessment because of the significant pain the patient will be in. Bowel sounds are of little value in the field and generally are not included in the abdominal assessment. Patients with severe abdominal pain typically prefer to lie on their side with their knees drawn up into their chest fetal position. Moving them from this position will aggravate their pain. Flashcard 66. You are caring for a conscious patient who you believe is having an acute ischemic stroke. After administering oxygen, your next priority should include providing prompt transport for possible fibrinolytic therapy. Administering 1 tube of oral glucose to rule out hypoglycemia. Closely monitoring the blood pressure every 15 to 20 minutes. Determining whether the patient has prescribed nitroglycerin. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: fibrinolytic clotbuster therapy is critical to a patient who is having a stroke if it is initiated within 3 hours after the onset of symptoms. It is critical to ask a family member or bystander when the patient was last seen normal. In addition to providing supplemental oxygen, transport the patient without delay so that she may receive fibrinolytic therapy if she is a candidate at the hospital. Because fibrinolytic therapy decreases the blood's ability to clot, its use is limited to patients with ischemic strokes. It would increase intracerebral bleeding in patients with hemorrhagic stroke. Therefore, fibrinolytic therapy is contraindicated for these patients. Hypoglycemia can easily be ruled out by assessing the patient's blood glucose level with a glucometer. Nitroglycerin is of no relevance in this scenario because the patient is not suspected of having a cardiac event. Monitor the patient's vital signs every 5 to 15 minutes, or as dictated by her clinical condition, while en route to the hospital. Flashcard 67. You are called to the residence of a 39-year-old male with flu-like symptoms. The patient tells you that he has been feeling ill for the last 2 days. He has a fever, headache, and diarrhea, and asks that you take him to the hospital. His blood pressure is 120/60 mmHg, his pulse is 110 beats/min, and his respirations are 16 breaths/min. You should request an ALS ambulance to the scene to start Roman 4 line. Ask him if he has a history of HIV infection or hepatitis. Advise him that he can drive himself to his family physician. Offer oxygen and transport him in a position of comfort. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: although the patient is likely experiencing the flu, there are other diseases, some of which are communicable, that can cause similar symptoms. The patient is requesting EMS transport. Failure to comply constitutes abandonment. Although he is tachycardic, the remainder of his vital signs are stable. Therefore, requesting an ALS ambulance to the scene to start Roman 4 is not necessary. Simply transport him in a position of comfort and offer him supplemental oxygen. If the patient is infected with HIV or hepatitis, he may choose to voluntarily disclose that information. However, to inquire about infection with such diseases is unethical. Flashcard 68. In general, you should avoid rewarming a frostbitten body part in the field if arrival at the emergency department will be delayed. The affected part could refreeze after rewarming. You are unable to obtain water that is at least 120 degrees F. A paramedic is not present to administer analgesia. Think of the answer before the reveal. The answer is, the correct answer is B. Reason: frostbitten body parts should not be rewarmed if there's a chance that they could refreeze after you have rewarmed them. If an extremity thaws and then refreezes, the amount of tissue and cellular damage may be worse than the damage caused by the initial freezing. A delay in getting the patient to the emergency department warrants rewarming. If rewarm, the extremity should be immersed in water that is 105 degrees to 112 degrees F. Analgesia would certainly be a comfort to the patient, although its absence does not negate rewarming a frostbitten body part in the field. Flashcard 69. When caring for a patient with an acute behavioral crisis, your primary concern should be gathering all of the patient's medications. Obtaining a complete past medical history. Ensuring you and your partner's safety. Providing safe transport to the hospital. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: when caring for a patient with a behavioral or emotional crisis, your primary concern should be for your own personal safety as well as your partner's safety. Your ultimate goal is to transport the patient to the hospital safely. Gather as much medical history information as possible, but keep in mind that many patients experiencing an emotional or behavioral crisis will not readily provide this information. It is important to remember that patients with emotional or behavioral crises may appear calm initially. However, there is always the potential for them to turn violent. Flashcard 70. Unresponsiveness, shallow breathing, and constricted pupils are indicative of what type of drug overdose? Marijuana. Amphetamine. Narcotic. Barbiturate. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: signs of a narcotic opiate overdose from drugs such as heroin, morphine, astromorph, duramorph, meperidine, demerol, or codeine include altered mental status, slow, shallow breathing, pupillary constriction, miosis, hypotension, and bradycardia. Narcotics are central nervous system depressants that, when taken in excess, suppress the vital functions necessary for life, such as breathing, heart rate, and blood pressure. Barbiturates produce the same effects. However, the pupils are typically dilated mydriases, not constricted. Marijuana and amphetamine drugs are central nervous system stimulants and would thus cause the patient to become restless or even combative. Flashcard 71. Propoxyphene Darvon is categorized as what type of drug? A: narcotic, B: amphetamine, C: benzodiazepine, D: barbiturate. Think of the answer before the reveal. The answer is. The correct answer is A. Reason: propoxyphene Darvon is in the narcotic opiate class of drugs. Other narcotics include heroin, morphine, codeine, and meperidine demerol. Phenobarbital is an example of a barbiturate. Drugs such as Valium, Klonopin, and Xanax are benzodiazepines. Amphetamines include drugs such as Ritalin, Adderall, and Focalin. Flashcard 72. A 60-year-old man presents with a severe right-sided headache. He is conscious and alert. As you're assessing him, he tells you that the left side of his body feels weak. His blood pressure is 190/1 mmHg, pulse is 88 beats/min, and respirations are 14 breaths/min. His past medical history includes diabetes, arthritis, and hypertension. You should be most concerned with A: his current blood pressure. B: the location of his headache. C: his blood glucose level. D: the presence of hemiparesis. Think of the answer before the reveal. The answer is. You selected D. This is correct. Reason: headaches are a common medical complaint and have numerous causes, most of which are not life-threatening. Common causes of a headache include migraine and cluster headaches, sinusitis, and muscle tension, among others. In some patients, however, a headache can signal a serious problem. In this patient, you should be most concerned with his unilateral weakness hemiparesis. This is not a common finding in patients with otherwise benign headaches and suggests a serious underlying problem, for example, intracranial bleeding, brain tumor. The fact that his headache is to the right side of his head and his weakness is to the left side of his body suggests that the problem lies in the right side of the brain. It is doubtful that his blood glucose level (BGL) is abnormal. He is conscious and alert. However, it would not be unreasonable to assess his BGL. His blood pressure, which is significantly elevated, could be causing his headache or may be the result of other factors such as non-compliance with his antihypertensive medication, anxiety, or pain. Flashcard 73. Which of the following would most likely cause a rapid drop in a patient's blood glucose level? A: mild exertion after eating a meal. B: forgetting to take prescribed insulin. C: taking too much prescribed insulin. D: eating a meal after taking insulin. Think of the answer before the reveal. The answer is. You selected C. This is correct. Reason: compared to diabetic coma, hyperglycemic ketoacidosis, hyperglycemic crisis, insulin shock, hypoglycemia. Hypoglycemic crisis has a rapid onset. It is commonly caused when a patient accidentally takes too much prescribed insulin. Insulin is a fast-acting drug that rapidly causes glucose to exit the bloodstream and enter the cell. Other common causes of hypoglycemia include taking a regular dose of insulin but not eating or taking insulin and exercising heavily. Eating a meal after taking insulin typically does not cause a significant change in the patient's blood glucose level. If a person fails to take his or her insulin, glucose will not be able to enter the cell and will accumulate in the bloodstream. Hyperglycemia. Flashcard 74. A 44-year-old woman was bitten on the ankle by an unidentified snake while working in her garden. She is conscious and alert, has stable vital signs, and denies shortness of breath. Her only complaint is a burning sensation at the wound site. Your assessment reveals 2 small puncture wounds, redness, and swelling. You should, conclude that envenomation likely did not occur, provide reassurance, and allow a friend to take her to the hospital. B: give supplemental oxygen, splint her leg to decrease movement, and keep her leg below the level of her heart. C: elevate her leg, cover the wound with a dry sterile dressing, and apply an ice pack to reduce pain and swelling. D: administer high-flow oxygen, apply a constricting band proximal to the bite, and use ice to prevent venom spread. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: given the fact that the snake was not identified, you should assume that it was poisonous. Furthermore, the presence of puncture wounds, burning, redness, and swelling are suggestive of envenomation. Therefore, you should provide emergency care and transport the patient to the hospital. Treatment for a snake bite involves keeping the patient calm, administering oxygen, splinting the affected extremity to decrease movement helps slow the spread of venom, keeping the extremity below the level of the heart, and transporting the patient to the hospital. Do not apply ice to a snake bite. It may constrict the blood vessels and force venom further into the bloodstream. The use of a proximal constricting band is controversial. If one is used, it should be loose, not tight. En route to the hospital, monitor the patient's vital signs and mental status and be alert for vomiting. Flashcard 75. A 34-year-old female complains of persistent fever, fatigue, and night sweats. During your assessment, you note that she has purple blotches on her arms and legs. She most likely has A: HIV/AIDS, B: chickenpox, C: tuberculosis, D: viral hepatitis. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: signs of human immunodeficiency virus HIV infection include persistent fever, weight loss, fatigue, a cough, and night sweats. The presence of purple skin blotches, malignant lesions called Kaposi's sarcoma, is consistent with acquired immune deficiency syndrome AIDS, also known as late-stage HIV infection. Patients with tuberculosis TB also present with fever, fatigue, weight loss, a cough, and night sweats. However, skin lesions are not common. Hepatitis is characterized by right upper quadrant abdominal pain, fever, nausea and vomiting, and a yellow tint to the skin and sclea jaundice. Chickenpox is unlikely. The associated rash is characterized by pustules that crust over, not purple blotches. Flashcard 76. The daughter of an elderly patient states that her mother is acting confused and talking incoherently. This nature of illness is most consistent with A: diabetic complications, B: altered mental status, C: cardiac compromise, D: behavioral problems. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: the nature of illness is a category in which you place the patient based on his or her chief complaint. A chief complaint of confusion and incoherent speech suggests that altered mental status is the nature of illness. An altered mental status can be caused by a variety of problems, including diabetic and behavioral problems, and in some cases, cardiac problems. Flashcard 77. Which of the following statements regarding heat stroke is correct? A: heat stroke is caused by a hyperactive sweating mechanism. B: not all patients experiencing heat stroke have dry skin. C: as core body temperature rises, the patient becomes more agitated. D: heat stroke is more likely to occur when the humidity is low. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: heat stroke occurs when the body is exposed to more heat than it can eliminate, and normal mechanisms for eliminating heat, such as sweating, are overwhelmed. The core body temperature then rises rapidly to the point where tissues are destroyed. Heat stroke can develop in patients during prolonged vigorous physical activity or when they are in a closed, poorly ventilated, hot and humid space. High humidity impairs a person's ability to eliminate heat via the sweating mechanism. Many patients with heat stroke have hot, dry, Flushed skin. However, early in the course of heat stroke, the skin may be moist due to residual perspiration, as with exertional heat stroke. As the core body temperature rises, the patient's level of consciousness decreases. Untreated heat stroke will result in death. Flashcard 78. Law enforcement requests your assistance to evaluate a young female who they believe has overdosed. The patient is conscious, is displaying bizarre behavior, and is very restless. Her BP is 170/90 mmHg and her heart rate is 130 beats/min. You see needle tracks on both of her arms. She is most likely under the influence of a benzodiazepine, B sedative hypnotic, C powerful narcotic, D methamphetamine. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: the needle tracks on the patient's arms indicate narcotic abuse, most likely heroin. However, her signs and symptoms are not consistent with those caused by a narcotic or any other central nervous system CNS depressant, for example, benzodiazepine, a sedative hypnotic. Signs of CNS depression include a decreased level of consciousness, hypoventilation, bradycardia, and hypotension. Her signs and symptoms are consistent with a sympathomimetic copper overdose. Sympathomimetic drugs mimic the effects of the sympathetic fight or flight nervous system. Therefore, restlessness or hyperactivity, hypertension, tachycardia, and pupillary dilation are common findings in patients who overdose. Amphetamine and methamphetamine, for example, ice, speed, crack, are examples of sympathomimetics. Flashcard 79. Which of the following signs and symptoms are most characteristic of hyperglycemic ketoacidosis? A: warm, dry skin and a slow onset. B: warm, dry skin and a rapid onset. C: cool, clammy skin and a rapid onset. D: cool, clammy skin and a slow onset. Think of the answer before the reveal. The answer is, you selected A. This is correct. Reason: hyperglycemic ketoacidosis diabetic coma is characterized by a dangerously high blood glucose level, hyperglycemia, slow onset, warm, dry skin from dehydration, and Kussmaul's respirations, which are deep and rapid and have a fruity or acetone odor. Insulin shock results from a low blood glucose level, hypoglycemia, and is characterized by a rapid onset, altered mental status, and cool, clammy skin. Flashcard 80. Which of the following statements regarding lightning-related injuries is correct? A: multiple fractures, including those of the cervical spine, are the most common cause of lightning-related deaths. B: the majority of patients who are struck by lightning die, even if CPR is provided immediately. C: because of the high electrical energy associated with lightning, full-thickness burns are a common finding. D: the cardiovascular and nervous systems are most commonly injured during a lightning strike. Think of the answer before the reveal. The answer is, the correct answer is D. Reason: the cardiovascular and nervous systems are most commonly injured during a lightning strike. Therefore, respiratory or cardiac arrest is the most common cause of lightning-related deaths, especially if CPR is delayed. A lightning strike typically induces a systole cardiac standstill. However, this spontaneously resolves in some people or can be reversed with early, high-quality CPR. The energy associated with lightning is composed of direct current DC of up to 200,000 amperes and a potential of 100 million volts or more. However, the duration of a lightning strike is short. Therefore, skin burns are usually superficial. Full-thickness third-degree burns are rare. Lightning causes massive contraction of all the body's muscles, potentially resulting in long bone and spinal fractures. Although this can clearly increase morbidity, it is not the most common cause of lightning-related deaths. Flashcard 81. You are transporting a 30-year-old man who is experiencing an emotional crisis. The patient does not speak when you ask him questions. How should you respond to his unwillingness to speak? A: remain silent until the patient speaks to you. B: do not speak to the patient even if he begins to speak to you. C: tell the patient that you cannot help if he won't talk. D: continually encourage the patient to talk to you. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: when dealing with a psychiatric patient who is silent and unwilling to speak to you, do not fear the silence. The patient simply does not wish to speak. You should not press the issue, for doing so may upset the patient. You should remain calm until the patient speaks to you and then respond accordingly. Flashcard 82. An elderly man is found unresponsive in his kitchen. The patient's wife tells you that her husband has diabetes and that he took his insulin, but did not eat anything. You should suspect A: diabetic coma, B: hypoglycemia, C: ketoacidosis, D: hyperglycemia. Think of the answer before the reveal. The answer is: the correct answer is B. Reason: several factors point to a field impression of hypoglycemia. First, the patient is known to have diabetes, and second, he took his insulin but did not eat. Because insulin promotes the uptake of glucose into the cells, if the patient does not replace this glucose by eating, the glucose level in the blood will fall to dangerously low levels. Hypoglycemia can also occur when a patient takes too much of his or her insulin. Hyperglycemia occurs when a patient does not take his or her insulin. In such cases, glucose accumulates in the bloodstream and is not able to enter the cell. In the absence of glucose, the cells begin to metabolize fat, which results in the production of ketosids and leads to hyperglycemic ketoacidosis, diabetic coma, hyperglycemic crisis. Flashcard 83. You and your partner arrive at the home of a 60-year-old man with shortness of breath. As you enter the residence, you find the patient sitting in his recliner. He is in obvious respiratory distress. As you approach him, he becomes verbally abusive, stating that it took you too long to get to his home. A small handgun is sitting on a table next to his recliner. You should A: verbally distract the patient as your partner attempts to retrieve the gun. B: slowly back your way out of the residence and call law enforcement. C: turn around, rapidly exit the residence, and notify law enforcement. D: explain the reason for your delay as your partner administers oxygen. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: there is an immediate threat to you and your partner's safety. The patient is verbally abusive and has a firearm within arm's reach. In this situation, you and your partner should slowly back away from the patient, exit the residence, and notify law enforcement. Do not take your eyes off of the patient. If you turn your back, you may take a bullet in the back. Backing away gives you the opportunity to take cover if you see the patient reach for his gun. Remember, your safety comes before all else. Flashcard 84. A 55-year-old woman with a history of diabetes is found unresponsive with rapid, shallow respirations. The patient's husband tells you that he does not know when his wife last took her insulin. Management of this patient should include a: subcutaneous injection of insulin and 100% oxygen. B: oral glucose and oxygen via non-rebreathing mask. C: assisted ventilations and oral glucose. D: assisted ventilations and rapid transport. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: without knowing if and when the patient last took her insulin, it is difficult to determine if she is experiencing diabetic coma or insulin shock. Nonetheless, her rapid, shallow respirations, which are likely not producing adequate tidal volume, should be treated with ventilation assistance. Because she is unresponsive and obviously unable to swallow, oral glucose is contraindicated. Assess the patient's blood glucose level and pass this information along to the hospital. If possible, arrange for a paramedic intercept so she can receive intravenous dextrose. If the patient is experiencing diabetic coma, insulin is what she truly needs. However, insulin is rarely, if ever, administered in the pre-hospital setting even by paramedics. After ensuring adequate oxygenation and ventilation, transport the patient without delay. Flashcard 85. When treating an unresponsive man who was struck by lightning, you should manually stabilize his head and open his airway. Apply full spinal precautions before moving him. Begin CPR at once if he is apneic and pulseless. Ensure that you and the patient are in a safe place. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: contrary to popular belief, lightning can and does strike in the same place twice. After lightning strikes, the ground remains electrically charged for a period of time. This increases the chance of a second strike within a short period of time. You must first ensure that you and the patient are safe by moving to a sheltered area, preferably indoors. After you have ensured the safety of yourself and the patient, begin treatment as dictated by the patient's condition. Do not let the life you save, or attempt to save, take your own. Flashcard 86. You are assessing a 40-year-old male with an apparent psychiatric crisis. According to the man's wife, he has a history of depression and schizophrenia and takes Zoloft and Zyprexa. A police officer is present at the scene. The patient, who is obviously scared, tells you that he sees snakes everywhere. You should let him know that going to the hospital will keep him safe from the snakes. Let him know that it is important for him to be transported as soon as possible. Tell him that you do not see any snakes, but they are obviously scaring him. Advise him that you suspect he has not been compliant with his medications. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: when caring for any patient with a behavioral emergency, your primary responsibility is to yourself to stay safe. The patient in this scenario, although scared, is not violent. In cases such as this, you should be prepared to spend extra time with the patient. It may take longer to assess, listen to, and prepare the patient for transport. Just because he is experiencing an acute crisis does not mean that he has not been taking his medications. To make that assumption is merely speculation on your part. You must be honest, reassuring, and non-judgmental. Let the patient tell you how he or she is feeling in his or her own words and acknowledge any auditory or visual hallucinations. Do not, however, play along with his or her hallucinations. This is cruel and only reinforces that what the patient is hearing or seeing is real. Flashcard 87. Which of the following structures is not part of the endocrine system? A: gallbladder, B: pancreas, C: thyroid, D: pituitary. Think of the answer before the reveal. The answer is, you selected A. This is correct. Reason: the gallbladder, which concentrates and stores bile, is not an endocrine organ. It is a digestive organ. Endocrine organs produce hormones, which regulate other body organs and systems. The thyroid regulates metabolism, the pancreas produces insulin and glucagon, and the pituitary gland, which is located within the brain, is the master endocrine gland and regulates the function of all endocrine glands in the body. Flashcard 88. Assessment and treatment of a patient with severe abdominal pain should include A: giving the patient small sips of water. B: placing the patient in a supine position. C: administering supplemental oxygen. D: vigorously palpating the abdomen. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: patients with severe abdominal pain should be given supplemental oxygen in a concentration sufficient to maintain an SpO2 of greater than 94% and immediate transport. Most patients with abdominal pain prefer to lie on their side with their knees drawn up into their chest fetal position, which takes pressure off of the abdominal musculature and often affords them some relief. Vigorous palpation of the abdomen should be avoided, as this will only cause the patient more pain. Instead, gently palpate each of the 4 abdominal quadrants, palpating the most painful area last. Because the patient may become nauseated and vomit, and the possibility that he or she may require surgery, do not give him or her anything to eat or drink. Flashcard 89. You receive a call for a 54-year-old female who is having a seizure. When you arrive at the scene, the patient is actively seizing. Her husband tells you that she has a history of seizures, and that she has been seizing continuously for 20 minutes. It is most important for you to recognize that her husband's description is consistent with status epilepticus. The patient may have stopped taking her seizure medication. Her seizure could be the result of a low blood glucose level. The patient is hypoxic and needs oxygen as soon as possible. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: there are many causes of seizures, including non-compliance with prescribed anticonvulsant medications, hypoglycemia, stroke, head trauma, and poisoning, among others. Regardless of the underlying cause, it is most important to recognize that patients who are actively seizing, especially if the seizure is prolonged, are hypoxic and need high-flow oxygen as soon as possible. In many cases, it may be necessary to assist the patient's ventilations. The husband's description of the seizure, for example, continuous for 20 minutes, is consistent with status epilepticus, which is all the more reason to recognize that she is severely hypoxic. Seizure-related deaths are the result of cerebral hypoxia. Flashcard 90. When insulin levels in the blood remain high, a fruity odor can be detected on the patient's breath. Glucose is rapidly taken out of the blood to fuel the cells. The patient urinates excessively and becomes dehydrated. The cells starve for glucose and begin to metabolize fat. Think of the answer before the reveal. The answer is: the correct answer is B. Reason: insulin is a hormone that promotes the cellular uptake of glucose from the bloodstream. If insulin levels remain high, such as when a diabetic inadvertently takes too much insulin, glucose is rapidly taken out of the blood to fuel the cells. This leads to low circulating blood glucose levels, hypoglycemia, and a condition called insulin shock. By contrast, if insulin levels are too low, such as when a diabetic forgets to take his or her insulin, glucose cannot enter the cells and pools in the bloodstream, hyperglycemia. In the absence of glucose, the cells begin to metabolize fat, which produces ketosids, diabetic ketoacidosis DKA. The respiratory system attempts to eliminate ketosids from the blood with an increased rate and depth of breathing that is accompanied by a fruity or acetone breath odor, small respirations. Hyperglycemia causes the patient to eliminate excess water from the body through urination diuresis, resulting in dehydration. Flashcard 91. The bite of a brown recluse spider is characterized by: 2 small puncture marks, swelling, and a late onset of pain. Immediate pain, swelling at the site, and painful muscle spasms. Rapid swelling within 30 minutes and a decline in mental status. Delayed onset of pain, swelling, and blister formation at the site. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: the venom of a brown recluse spider is cytotoxic. That is, it causes tissue and cellular damage. The bite itself is usually painless. However, the patient typically begins to complain of pain within a few hours. The area becomes swollen and tender, developing a pale, mottled, cyanotic center and possibly a small blister. Over the next several days, a scab of dead skin, fat, and debris will form and dig down into the skin, producing a large ulcer that may not heal unless promptly treated. The bite of a brown recluse spider is very small, therefore, puncture marks are not visible. Unlike the brown recluse spider, the black widow spider bite is characterized by immediate pain. Its venom is neurotoxic, that is, it suppresses the central nervous system. The patient typically complains of intense muscle spasms, especially of the abdomen, and systemic signs of nervous system involvement, for example, dizziness, chest pain, difficulty breathing. Flashcard 92. Which of the following is the most significant finding in a patient experiencing an allergic reaction? A: widespread rash. B: abdominal cramps. C: headache. D: hoarseness. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: a rash, urticaria, headache, abdominal cramps, and hoarseness are all signs of an allergic reaction. However, the presence of hoarseness is the most significant finding because it indicates upper airway swelling. Other significant findings include swelling of the face, neck, or tongue, wheezing and or stridor, difficulty breathing, tachycardia, and hypotension. Death due to a severe allergic reaction anaphylaxis is caused by vascular collapse caused by massive vasodilation and respiratory failure caused by upper and or lower airway swelling. Flashcard 93. You receive a call to a restaurant where a 34-year-old man is experiencing shortness of breath. When you arrive, you immediately note that the man has urticaria on his face and arms. He is conscious, but restless and is in obvious respiratory distress. You should: obtain a set of baseline vital signs and a sample history. B: place a non-rebreathing mask set at 15 L/min on the patient. C: ask the patient if he has an epinephrine auto-injector. D: remove the patient's shirt to inspect his chest for urticaria. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: initial management of a patient with a suspected allergic reaction is to ensure a patent airway and provide high-flow oxygen. Positive pressure ventilation may be required if the patient is breathing inadequately. After ensuring a patent airway and adequate ventilation and oxygenation, you should inquire whether the patient has a prescribed epinephrine auto-injector. If so, you should contact medical control and obtain permission if required by local protocol to assist the patient with the auto-injector. Flashcard 94. Your patient is a 75-year-old female who, according to her son, tripped on a throw rug and fell. The patient is conscious and alert, is sitting on the couch, and has a hematoma to her forehead. When you ask her what happened, her son interjects by saying, "I already told you she tripped and fell." As you further question her, you find that she is hesitant to answer your questions and keeps looking at her son. You should: interview the patient and her son separately if possible. B: tell the son that you suspect his mother has been abused. C: notify law enforcement and have the son removed. D: ask the patient if someone hurt her intentionally. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: there are several indicators that suggest this patient's injury was intentionally inflicted. The son's interjection, her hesitance to answer your questions, and the fact that she keeps looking at her son. If possible, interview the patient and her son separately. Doing so may reveal inconsistencies regarding the event, which would further increase your index of suspicion for abuse. You must not, however, accuse her son of abuse or insinuate such. If you are wrong, you could be liable for slander. At present, the son is not verbally or physically abusive. However, if he becomes abusive, you should notify law enforcement at once. Remember, you are legally obligated to report any suspicions of abuse or neglect to the emergency department physician. You should make every effort to convince the patient to consent to treatment and transport. Flashcard 95. Which of the following signs or symptoms is most suggestive of a systemic reaction following ingestion of a poison? A: painful or difficult swallowing. B: burns around the mouth. C: tachycardia and hypotension. D: nausea and vomiting. Think of the answer before the reveal. The answer is: You selected C. This is correct. Reason: once an ingested poison gets into the system, it can affect multiple organ systems. Signs that this is occurring include tachycardia or bradycardia, hypotension or hypertension, weakness, restlessness, and an altered level of consciousness, among others. Local effects of an ingested poison include nausea and vomiting, as the poison irritates the gastric lining, burns in and around the mouth, and painful or difficult swallowing dysphagia. Flashcard 96. A patient with a core body temperature of 94 degrees F would most likely present with a colon joint and muscle stiffness. B colon shivering and pale skin. C colon decreased muscle activity. D colon an altered mental status. Think of the answer before the reveal. The answer is. The correct answer is B. Reason: mild hypothermia is defined as a core body temperature CBT between 93.2 degrees F and 96.8 degrees F, 34 degrees C, and 36 degrees C. Mildly hypothermic patients are usually alert and shivering in an attempt to generate heat through muscular activity. Their skin is typically pale due to the body's constriction of blood vessels at the skin to retain heat. In moderate hypothermia CBT between 86 degrees F and 93.2 degrees F, 30 degrees C, and 34 degrees C, shivering stops and muscular activity decreases. As the CBT falls further, all muscle activity stops. In severe hypothermia CBT 86 degrees F, 30 degrees C, vital functions decrease, for example, level of consciousness, BP, pulse, respirations, and the patient is at risk for life-threatening cardiac dysrhythmias. The muscles become rigid and the patient appears stiff. The patient may appear dead. Although a pulse is present, it may not be palpable. Flashcard 97. An 80-year-old woman has pain in the right upper quadrant of her abdomen and a yellow tinge to her skin. You should suspect dysfunction of the A colon gallbladder, B colon liver, C colon pancreas, D colon spleen. Think of the answer before the reveal. The answer is. You selected B. This is correct. Reason: pain in the right upper quadrant and skin with a yellow tinge to it. Jaundice indicates a problem with the liver. Jaundice is the result of an excess level of bilirubin in the blood. Bilirubin, a yellow-colored substance, is the waste product that remains in the bloodstream after the iron is removed from the hemoglobin. One of the functions of the liver is to filter out waste such as bilirubin from the blood. If the liver is not functioning properly, bilirubin accumulates in the bloodstream. Dysfunction of the pancreas would result in possible fluctuations in the levels of blood glucose. Gallbladder inflammation cholecystitis typically produces right upper quadrant pain and or referred pain to the right shoulder that occurs shortly after eating. Dysfunction of the spleen would cause left upper quadrant pain and or referred pain to the left shoulder. Flashcard 98. A man is experiencing a severe allergic reaction after being stung by a scorpion. He does not have his own epinephrine. However, his wife is allergic to bees and has a prescribed epinephrine autoinjector. You should request an ALS unit to respond to the scene to administer epinephrine. B provide rapid transport and consider an ALS rendezvous. C assist the patient with the wife's prescribed epinephrine. D assist the patient with 1/2 the usual dose of the wife's epinephrine. Think of the answer before the reveal. The answer is. You selected B. This is correct. Reason: if a patient does not have a prescribed epinephrine autoinjector and is experiencing a severe allergic reaction, you should administer supplemental oxygen, assist the patient's ventilations if needed, and transport without delay. Closely monitor the patient's airway and breathing status en route and coordinate an ALS rendezvous if possible. If you carry an epinephrine autoinjector on your ambulance and your protocols allow you to administer it, do so without delay. Otherwise, the ALS unit will be able to administer epinephrine via the intramuscular or intravenous route. Never assist a patient with a medication that is not prescribed to him or her specifically. Flashcard 99. You are transporting a 35-year-old male who has a history of alcoholism. He stopped drinking 4 days ago and is now disoriented, diaphoretic, and tachycardic. You should be most concerned that he A: may have a seizure. B: is severely dehydrated. C: will develop a high fever. D: will begin hallucinating. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: a patient in alcohol withdrawal may experience frightening hallucinations or delirium tremens DTS, a syndrome characterized by restlessness, fever, disorientation, sweating, agitation, and even seizures. About 1 to 7 days after a person stops drinking or when alcohol consumption levels are suddenly decreased, DTs may develop. Patients with DTs are often dehydrated due to sweating, fluid loss, insufficient fluid intake, or vomiting, and their hallucinations can be extremely frightening. However, the possibility of a seizure, clearly the most life-threatening complication associated with DTs, should concern you the most. Flashcard 100. While triaging patients at a mass casualty incident, you encounter a responsive middle-aged female with a respiratory rate of 26 breaths/min. What should you do next? A: triage her as immediate red tag. B: administer high-flow oxygen at once. C: assess for bilateral radial pulses. D: assess her ability to follow commands. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: according to the simple triage and rapid treatment start method, if you encounter an adult patient with a respiratory rate that is less than 10 breaths/min or greater than 29 breaths/min, you should triage him or her as immediate red tag and move to the next patient. However, if the patient's respiratory rate is between 10 and 29 breaths/min, you should assess his or her hemodynamic status by checking for bilateral radial pulses. If the patient's radial pulses are absent, triage him or her as immediate and move to the next patient. If the patient's radial pulses are present, assess his or her ability to follow simple commands. If the patient is able to follow simple commands, triage him or her as delayed yellow tag and move to the next patient. If the patient is unable to follow simple commands, triage him or her as immediate and move to the next patient. Treatment does not occur during the initial triage process. Flashcard 101. The ultimate goal of any EMS quality improvement program is to A: recognize all EMTs who demonstrate consistency in providing competent patient care. B: provide protocols to all EMTs and hold them accountable if protocols are not followed. C: deliver a consistently high standard of care to all patients who are encountered. D: ensure that all personnel receive an adequate number of continuing education hours. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: providing continuing education to all personnel, recognizing those who consistently provide competent patient care, and holding all personnel accountable for adhering to the EMS protocols are all components of any EMS quality improvement program. The ultimate goal, however, is to provide, as a system, a consistently high standard of care to all patients who are encountered. Flashcard 102. A set of regulations and ethical considerations that define the extent or limits of an EMT's job is called A: the Medical Practices Act. B: confidentiality. C: a duty to act. D: scope of practice. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: the set of legal regulations and ethical considerations that define the job of the EMT is called the scope of practice. The scope of practice provides a clear delineation of the EMT's roles and responsibilities. Duty to act is defined as a legal obligation to respond to every call for help while on duty and in your jurisdiction, whether you are paid for your services or not. Confidentiality entails not releasing any patient information to those not directly involved in the care of the patient. The Medical Practices Act describes the minimum qualifications of those who may engage in emergency medical care and establishes a means of certification. Flashcard 103. The scene size-up includes all of the following components except A: evaluating the mechanism of injury. B: determining if the scene is safe. C: assessing the need for assistance. D: donning personal protective G. Think of the answer before the reveal. The answer is: you selected A. The correct answer is D. Reason: the components of the scene size-up include determining scene safety, assessing the mechanism of injury or nature of illness (NOI), determining the number of patients, and requesting additional help if needed. Personal protective equipment (PPE) should be donned prior to beginning the scene size-up. Flashcard 104. You are called to transport a patient with terminal lung cancer from a skilled nursing facility to the emergency department for evaluation of possible pneumonia. As you are reviewing the transfer paperwork, you see that the patient has a valid do not attempt resuscitation order. During transport, you should A: monitor the patient because a DNR order prohibits you from providing care. B: provides supportive care, such as oxygen, and keep the patient comfortable. C: perform CPR for only 2 minutes if the patient develops cardiac arrest. D: disregard the DNR order because it is only valid in the hospital setting. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: a valid do not attempt resuscitation DNR order gives you the legal authority not to initiate resuscitative efforts if the patient develops cardiac arrest. Because laws vary from state to state, you must be familiar with the DNR laws inherent to the state in which you work as an EMT. Many states have adopted out-of-hospital DNR orders. These are legal documents and should be adhered to if they are valid. Generally speaking, a valid DNR order must clearly state the patient's medical problem S, be signed by the patient or legal guardian, and be signed by one or more physicians. In some states, DNR orders have an expiration date, while in others, no expiration date is included. Contact medical control for guidance if the validity of a DNR order is questionable. Even in the presence of a valid DNR order, you are still obligated to provide supportive measures such as oxygen, pain relief, and comfort. DNR does not mean do not treat. Flashcard 105. Which of the following statements best describes a mass casualty incident? A: the number of patients overwhelms your resources. B: more than 3 vehicles are involved in the incident. C: more than 5 patients are involved. D: at least half of the patients are critically injured. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: a mass casualty incident (MCI) occurs anytime the number of injured patients overwhelms your available resources. It is not necessarily defined by the number of patients, but rather your ability to effectively manage them. For example, if you and your partner arrive at a scene and find 2 critically injured patients, you have an MCI, albeit a small-scale MCI, because 2 EMTs and 1 ambulance can only care for 1 critically ill or injured patient effectively. While caring for a trauma patient, blood splashes into an EMT's eyes. This is an example of A: infection. B: indirect contact. C: transmission. D: exposure. Flashcard 106. While caring for a trauma patient, blood splashes into an EMT's eyes. This is an example of A: infection. B: indirect contact. C: transmission. D: exposure. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: exposure occurs when an individual comes in direct contact with blood or other bodily fluids. Examples of direct exposure include blood splashing into the eyes or mouth and an accidental stick with a contaminated needle or other sharp object. Exposure does not always result in disease transmission and subsequent infection, That depends on whether the patient has an infectious disease. Routine use of standard precautions will afford the EMT the best protection from exposure to an infectious disease. Flashcard 107. Failure of the EMT to obtain consent from a responsive patient before taking his or her blood pressure may constitute A: assault, B: negligence, C: abandonment, D: battery. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: battery is defined as unlawfully touching another person without his or her consent. Obtaining consent from every responsive patient prior to rendering care is of paramount importance. Assault is defined as instilling fear into another person, but does not involve actually touching him or her. Negligence occurs when the EMT fails to act as another prudent EMT would have acted in the same or similar situation. Abandonment occurs when the EMT terminates patient care without the patient's consent or transfers care of a patient to a provider of lesser training. Flashcard 108. The EMT should avoid focusing all of his or her attention on a single critical patient during the triage process because A: the patient will most likely die before he or she can be transported. B: all of his or her supplies will likely be depleted on that one patient. C: 3 EMTs are required to effectively manage a critical patient. D: other patients may die of problems that may have been corrected. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: triage is the process of rapidly assessing patients in order to determine their treatment priority. Focusing your attention on one patient during the triage process not only defeats the purpose of triage to do the greatest good for the greatest number of people, but it neglects other patients who may die from injuries or conditions that may have been corrected if detected earlier. Flashcard 109. You are cleaning the back of the ambulance after transporting a patient with major trauma. Which of the following contaminated items should not be placed in a plastic biohazard bag? A: suction canister, B: plastic Roman IV catheter, C: rigid suction catheter, D: blood-soaked gauze pads. Think of the answer before the reveal. The answer is, you selected B. This is correct. Reason: contrary to popular belief, the end of a Teflon Roman IV catheter, the plastic catheter without the needle, can cut you. It is sharp. Therefore, it should be placed in a puncture-proof sharps container, not a plastic biohazard bag. Items that are blood-soaked or are otherwise contaminated, but cannot puncture, can safely be placed in a plastic biohazard bag. Flashcard 110. At the scene of a mass casualty incident, you notice a bystander who is emotionally upset. An appropriate action to take would be to A: tell the bystander to leave the scene at once. B: assign the bystander a simple non-patient care task. C: have the bystander assist you with patient care. D: notify the police and have the bystander removed. Think of the answer before the reveal. The answer is, you selected B. This is correct. Reason: one of the most effective ways to reduce stress in a bystander at the scene of a mass casualty incident is to assign the bystander a task that is not related to patient care. This may involve assisting other bystanders who are having difficulties as well or providing water to the rescuers. An obviously distressed bystander should not simply be sent away from the scene, but should be looked at as a patient as well. Clearly, if the bystander becomes aggressive or violent, law enforcement personnel should get involved. Flashcard 111. Which of the following statements regarding the high-efficiency particulate air HEPA respirator is correct? A: a HEPA respirator is necessary only if the patient with suspected tuberculosis is coughing. B: long sideburns or a beard will prevent the proper fit of a HEPA respirator. C: a HEPA respirator should be placed on any patient with tuberculosis. D: the surgical mask provides better protection against tuberculosis than a HEPA respirator. Think of the answer before the reveal. The answer is, you selected B. This is correct. Reason: if you are caring for a patient with known or suspected tuberculosis TB, regardless of whether the patient is coughing, you should place a surgical mask or high-flow oxygen, if indicated, on the patient, and a high-efficiency particulate air HEPA respirator N95 or higher on yourself. Unlike a surgical mask, the HEPA respirator is specifically designed to prevent exposure to the bacterium that causes TB. A surgical mask, however, will reduce the transmission of germs from the patient into the air. Do not place a HEPA respirator on the patient. It is unnecessary and uncomfortable. Use of a HEPA respirator should comply with OSHA standards, which state that facial hair, such as long sideburns or beards, will prevent a proper fit. Flashcard 112. You arrive at the scene of a young male who was stabbed when a burglar broke into his house. Law enforcement officers are present. The patient, who is unresponsive with several stab wounds to the chest, is lying in a narrow space between a couch and coffee table. You should move the coffee table, document what you did, and begin treatment. Treat the patient where he is, without moving the coffee table. Obtain permission from law enforcement before moving any furniture. Move the coffee table, begin patient care, and notify a police officer. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: after ensuring your own safety, your primary responsibility when functioning at a crime scene is to provide patient care. Optimally, you should help preserve the scene at the same time. In this situation, however, the patient requires immediate treatment. He is unresponsive and has life-threatening injuries. It would be difficult to provide effective care in his present position, and notifying law enforcement before you move any furniture would unnecessarily delay care. Therefore, you should move the coffee table out of the way and begin treatment. When possible, notify a law enforcement officer of what you moved, where you moved it to, and why you moved it. You should also document this on the patient care report after you have cared for the patient. Flashcard 113. Which of the following scene size-up findings is least suggestive of an unsafe environment? The sound of breaking glass as you approach a residence. B: screaming and yelling coming from inside a residence. C: liquid draining from a car that struck a telephone pole. D: a large man standing in his yard awaiting your arrival. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: when approaching a residence, findings that would suggest an unsafe scene include, among other things, the sound of breaking glass, screaming and yelling, and an unusual silence. Liquid leaking from a wrecked automobile should be assumed to be gasoline and, therefore, dangerous. Although intimidating in appearance, there is no correlation between a person's physical size and his or her potential for violence. Flashcard 114. You and your partner have secured a trauma patient to a long backboard and are preparing to lift the backboard onto the stretcher. When doing so, you should recall that most of the patient's weight is at the foot end of the backboard. B: ensure that the strongest EMT is positioned at the head of the backboard. C: lift the backboard from the sides instead of from the ends. D: be sure to lift the backboard with the powerful muscles of your back. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: since more than half of the patient's weight is distributed to the head end of a backboard, you should always ensure that the strongest EMT is at that position. This will reduce the risk of injury to less strong personnel as well as the risk of dropping the patient. The backboard should be lifted from the ends, not the sides. You have less control over the board if it is lifted from the sides. When lifting any patient, you should use the powerful muscles of your thighs, not your back, to lift. Keep your back straight and in a locked-in position. Flashcard 115. Upon arriving at the scene of an overturned tanker truck, you see a clear liquid leaking from the rear of the tank. The driver is still in the vehicle and you can see that his face is covered with blood. You should Request fire department assistance if they are not already en route. B: ensure that the ambulance is downwind and downhill from the tanker. C: put on gloves, a gown, and a mask and quickly remove the driver. D: approach the rear of the tanker to identify the type of fluid leaking. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: upon determining that you are dealing with a potential hazardous materials incident, you should immediately request specially trained personnel, for example, fire department, hazmat team, if they are not already en route to the scene. Do not approach a vehicle that may be leaking a hazardous material, even if the patient is still in the vehicle, or you may become a casualty as well. Most ambulances are not equipped with the personal protective equipment required for hazardous materials. Park your ambulance in a location that is both upwind and uphill from the incident. Until additional personnel arrive, try to identify the material being carried by reading the United Nations UN number on the safety placard affixed to the tanker. However, this should be done from a safe distance and with the use of binoculars. Flashcard 116. Which of the following situations is an example of abandonment? A: an EMT gives a verbal report to an emergency nurse. B: a paramedic transfers care to an advanced EMT. C: an EMT departs the scene after a paramedic arrives. D: an EMT transfers care of a patient to a paramedic. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: abandonment occurs anytime you disengage from a patient while he or she still requires care, or you relinquish your responsibility of patient care to a provider of lesser training. If a paramedic transfers patient care to an advanced EMT, clearly a provider with a lower level of training, then the paramedic has abandoned his or her patient. When delivering a patient to the emergency department, you must give your verbal report to a registered nurse or a physician. Flashcard 117. As soon as you begin transport of a patient to the hospital, you should: A: notify the receiving facility. B: conduct a detailed examination. C: contact medical control. D: advise dispatch of your status. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: immediately upon departing the scene with a patient, you should first inform the dispatcher that you are en route to the hospital. Never leave the dispatcher in the dark, for it is the dispatcher's job to know what units are available to answer emergency calls. Notifying the receiving facility, contacting medical control, and performing a detailed assessment of your patient all can occur while you are en route to the hospital. Flashcard 118. Upon arriving at the scene of a multiple vehicle crash, you can see that at least 2 patients have been ejected from their vehicles. You should: A: immediately triage the 2 patients. B: gather all of the patients together. C: treat the most critical patient first. D: request at least 1 more ambulance. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: 1 ambulance and 2 EMTs can effectively care for only 1 critical patient or 2 non-critical patients. As soon as you determine that the patient count exceeds your capabilities, you should immediately call for additional help. After doing this, you should begin the processes of triage and treatment. Flashcard 119. While en route to the scene of an injured person, dispatch advises you that law enforcement personnel are at the scene. This indicates that: A: the scene is safe for you to enter. B: a crime has been committed. C: the patient is critically injured. D: the scene is potentially unsafe. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: the presence of law enforcement at the scene indicates, at a minimum, that the scene is potentially unsafe, otherwise they would not be there. While you are en route, you should make radio contact with the police officers at the scene to determine if it is safe for you to enter. You should also inquire about the severity of the patient's injuries. The more information you obtain before you arrive, the better. For all you know, you could arrive and find yourself in the middle of a firefight. The mere presence of law enforcement at the scene does not ensure a safe environment. Flashcard 120. When sizing up a motor vehicle crash in which a small passenger car struck a bridge pillar and sustained severe damage, you should disconnect the battery cables and then request heavy extrication tools. Ensure that there are no hazards and then try to open one of the doors. Immediately approach the vehicle and determine if it is stable. Break the driver's side window and gain rapid access to the patient. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: after ensuring your own safety, you should attempt simple access to the patient, trying to get to him or her as simply and quickly as possible without using any tools or breaking any glass. It may be necessary to use tools or other forcible entry methods, some of which may require specialized extrication equipment, for example, jaws of life. Many times, however, the patient can be accessed simply by opening a door, even if the door is badly damaged. If the door is locked and the patient is responsive, ask him or her to unlock the door. Stabilizing the vehicle, for example, placing shoring blocks under the car and disconnecting the car's battery cables are typical functions of the fire department. Flashcard 121. Which of the following patients has the highest priority at the scene of a mass casualty incident? A 44-year-old unresponsive man with an open head injury and agnogasps. B 29-year-old man who is pulseless and apneic with an abdominal evisceration. C 35-year-old unresponsive woman with snoring respirations and severe burns. D 38-year-old woman who remains apneic after you manually open her airway. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: the goal of triage is to provide the greatest good for the greatest number of people. Relative to the other patients, who are either in respiratory or cardiac arrest or have injuries incompatible with life, the woman with snoring respirations and severe burns has the best chance for survival. Therefore, she has the highest treatment priority. Flashcard 122. Which of the following practices will provide you with the highest degree of safety when responding to an emergency call? A: always requesting fire department assistance. B: routinely using the lights and sirens. C: wearing your seatbelt and shoulder harness. D: asking the police to escort you to the scene. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: consistent safety practices, such as wearing your seatbelt and shoulder harness, driving with due regard for others, and avoiding excessive speed, will afford you the highest degree of safety when responding to an emergency call. Unless used to guide you to an area you are unfamiliar with, escort vehicles should be avoided. Escort vehicles are especially dangerous at intersections. As the escort vehicle proceeds through the intersection, other motorists often do not expect a second emergency vehicle to follow. As a result, they may pull out into the intersection, thinking it is clear, and collide with your ambulance wake effect collision. The use of lights and siren increases the danger factor, especially if used in conjunction with excessive speed. Lights and siren ask for, not demand, the courtesy of the right of way. Flashcard 123. Which of the following situations would necessitate treatment using implied consent? A: a 17-year-old pregnant woman with an isolated extremity injury. B: a 65-year-old man who is confused and suspected of having a severe stroke. C: a 25-year-old man who is restless and has severe chest pain and diaphoresis. D: an 18-year-old man who is now fully alert after receiving oral glucose. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: a patient may be treated under the law of implied consent, also called the emergency doctrine, any time he or she is unresponsive or otherwise lacks decision-making capacity, i.e., confused under the influence of drugs or alcohol. In cases such as these, The EMT should assume that the patient would consent to treatment and transport if he or she were able to make an informed decision. Examples of such patients include those who are intoxicated or who otherwise have an altered mental status, i.e., stroke, hypoglycemia. Patients younger than 18 years of age may also be treated under the law of implied consent, unless the patient is female and is emancipated or pregnant. Flashcard 124. You are called to a residence for a woman in cardiac arrest. Shortly after starting CPR, the patient's husband presents you with an unsigned document that states do not attempt resuscitation. You should contact medical control prior to continuing any resuscitative efforts. Stop all resuscitative efforts in accordance with the document. Continue CPR until you have contacted medical control for guidance. Stop CPR until the document can be validated by a physician. Think of the answer before the reveal. The answer is. The correct answer is C. Reason: do not attempt resuscitate. DNR orders are particularly challenging for EMS providers. When presented with documentation, especially if it does not appear to be valid, in this case, an unsigned document, you should err on the side of patient care and continue resuscitative efforts until medical control orders you to stop. Flashcard 125. In which of the following situations is an emergency move of a patient from his or her wrecked vehicle clearly indicated? The patient appears unresponsive and a high-power line is lying across the hood. The patient has an altered mental status, diaphoresis, and rapid, shallow breathing. Gas is leaking from the vehicle and there is a small fire in the engine compartment. Your primary assessment reveals that the patient has signs and symptoms of shock. Think of the answer before the reveal. The answer is. The correct answer is C. Reason: an emergency move is indicated if you or the patient's life is in immediate danger. Gas leaking from the vehicle and a fire in the engine compartment are clear indicators that you and the patient's lives are in imminent danger. An emergency move involves grabbing the patient by the clothing, protecting his or her spine as much as possible, and dragging him or her from the vehicle to a safe place. The rapid extrication technique, which involves manually stabilizing the patient's head, applying a cervical collar, and removing the patient from the vehicle onto a long backboard, is indicated if the patient's condition is unstable and or he or she is in need of treatment that requires a supine position. Never approach or touch a vehicle that is in contact with a high-power line. Have the power company cut the power to the line first and then remove the patient from the vehicle. Flashcard 126. Proper biomechanics when lifting and moving a patient include keeping the weight as close to you as possible. Twisting at the waist when moving around a corner. Using the muscles of your lower back to lift. Maintaining a slight curvature of your back. Think of the answer before the reveal. The answer is. You selected A. This is correct. Reason: general guidelines for safe lifting and moving include keeping the weight as close to your body as possible, keeping your back in a straight, locked-in position, using the muscles of your thighs to lift, and avoiding twisting when moving a patient around a corner. Back injuries are the most common injury sustained by the EMT and can be easily avoided if proper lifting and moving techniques are observed. Flashcard 127. Your partner, a veteran EMT of 20 years, has been showing up late to work with increasing frequency over the last several shifts. When he arrives, he is in a bad mood and is clearly not interested in being at work. His behavior is most consistent with acute stress, burnout, drug use, delirium. Think of the answer before the reveal. The answer is. You selected B. This is correct. Reason: your partner's behavior is consistent with burnout. Burnout is a condition of chronic fatigue, irritability, and frustration that results from mounting stress over time. Although burnout typically manifests after years of service in EMS, some EMTs begin to experience it in a very short period of time, especially if they work in EMS systems with a high call volume and low morale. Some people with burnout abuse drugs or alcohol. If you suspect this, you should report it to your supervisor immediately. The best way to prevent burnout is to recognize the signs of stress and take action to reduce it. An acute stress reaction occurs in response to a sudden, unexpected event. It is clear that your partner has had many stressful events over his career. Delirium is an acute change in cognitive ability. It commonly results from conditions such as hypoxia, hypoglycemia, and drug toxicity. Flashcard 128. When requesting medical direction for a patient who was involved in a major motor vehicle accident, you should do all of the following, except describe the severity of damage to the patient's vehicle. Use radio codes to describe the situation. Use proper medical terminology when speaking. Question in order if it seems to be inappropriate. You selected A. Think of the answer before the reveal. The answer is. The correct answer is B. When giving a report to medical control or requesting medical direction, you should avoid the use of radio codes, such as 10-50. The physician may not be familiar with such codes. There is clearly less risk of confusion if you use plain English. At the same time, you should use proper medical terminology, especially when describing the patient's injuries. Information regarding the severity of damage to the patient's vehicle is critical information and should be relayed to the physician. This can help him or her appreciate the significance of the situation. Do not be afraid to question an order that is contrary to your training or protocols. The physician may have simply made an error. Repeating an order back to the physician, word for word, will minimize the risk of this occurring. Flashcard 129. While assisting a paramedic in starting enrollment 4 on a patient, you are inadvertently stuck by the contaminated needle while attempting to place it in the sharps container. You should notify your supervisor and request an HIV test. Hold the paramedic liable for the needle stick. Cease patient care immediately. Seek medical care as soon as possible. Think of the answer before the reveal. The answer is. You selected D. This is correct. If you receive an exposure while providing patient care, you should notify your supervisor or designated infection control officer and seek medical care as soon as possible. However, this should be done after you have completed patient care. You will be tested for blood-borne pathogens such as HIV and hepatitis B, and based on the degree of exposure, the physician may suggest immediate treatment. The paramedic did not intentionally stick you with the needle, therefore, you cannot hold him or her liable. Careful and appropriate handling of needles and other sharps will reduce your risk of an accidental stick. Flashcard 130. You are called to a local state park where a hiker fell from a cliff into a thick, wooded area with rough terrain. It is cold and foggy and a thunderstorm is approaching. You will most likely move the patient to the ambulance by bringing the ambulance stretcher to the patient, loading him onto it, and removing him from the wooded area. Requesting a helicopter to hoist the patient out of the wooded area and carry him to a site near the ambulance. Placing the patient in a basket stretcher and using at least 4 people to carry him to the ambulance. Assisting the patient in walking from the wooded area to the ambulance if his injuries are not life-threatening. Think of the answer before the reveal. The answer is. The correct answer is C. The basket stretcher, also called a Stokes basket, is ideal for moving patients across rough terrain. Because the patient fell from a cliff, he will require spinal motion restriction precautions. Secure him to a long backboard and place the backboard in the basket stretcher. When carrying a patient across rough terrain, you should utilize at least 4 people to ensure a safe patient move. Clearly, the patient should not walk. He should be suspected of having a spinal injury due to the fall. A wheeled ambulance stretcher is impractical in situations where the patient must be moved over rough terrain. In many cases, a helicopter can be used to move patients from remote areas to a landing site near the ambulance or directly to the hospital. However, in this case, the weather, for example, fog, approaching thunderstorm, will likely prohibit a helicopter from being able to safely fly. Flashcard 131. You receive a call at 3:00 a.m. for a patient who is slumped over the steering wheel of his car, which is parked on the shoulder of the road. Your unit and a police officer arrive at the scene at the same time. You should stay in your unit until the police officer checks the patient. Shine a spotlight in the side view mirror of the patient's vehicle. Approach the vehicle from the front to ensure maximum visibility. Park the ambulance 25 feet in front of the patient's vehicle. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: unfortunately, it is not uncommon for people to fake illness or injury with the intent of harming responding personnel. In this situation, you should utilize the safety resource at the scene, the police officer. You and your partner should stay in the unit until the police officer checks the patient to ensure it is safe for you to approach. Remember, the safety of you and your partner comes first. Flashcard 132. As an NREMT, your primary responsibility is to keep yourself as safe as possible. B: transport all patients to the hospital. C: ensure the safety of your partner. D: provide competent patient care. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: as an EMT, your primary responsibility is to yourself. An injured or dead EMT is of no use to a patient. After ensuring the safety of yourself, your crew, and any bystanders, patient care should be initiated. Flashcard 133. Which of the following situations presents the greatest risk for suicide? A: woman who quit her job for one that pays a lot more. B: a man who was recently diagnosed with stage 4 lung cancer. C: an EMT who saved a drowning child and receives no media attention. D: a woman who is planning a family trip but gets called away to work. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: any patient with a significant, most often negative, life change is at risk for suicide. Common catalysts to suicide include chronic depression, the loss of a loved one or a job, relationship problems, financial difficulties, and the diagnosis of a serious or terminal illness. There have been a number of cases in which EMS personnel who performed a heroic act have committed suicide after receiving excessive media attention. Flashcard 134. A 30-year-old woman crashed her car into a tree at a high rate of speed. She is conscious and alert and has stable vital signs. She has some small lacerations and abrasions to her arms and face, but no obviously life-threatening injuries. As you are loading her into the ambulance, she tells you that she does not want to go to the hospital. You should advise her that she is probably too emotionally upset to be able to refuse EMS treatment and transport. B: obtain a signed refusal from the patient and ask a law enforcement officer to transport her to the hospital. C: advise the patient that she should be transported to the hospital because of the seriousness of the crash. D: ask a law enforcement officer to administer a breathalyzer test to determine if she has been drinking alcohol. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: the consequences of refusal should be explained to any patient who refuses EMS treatment and/or transport. After establishing that the patient can legally refuse treatment and transport, for example, he or she is of legal age and has decision-making capacity, you must advise her that because of the significant mechanism of injury, the potential for critical injury or death exists, even though she may feel fine now. Once this is explained, and the patient understands and is willing to accept the possible consequences, obtain a signed refusal and ask an impartial person, for example, police officer, to witness the signed refusal. Flashcard 135. A 70-year-old man with a history of emphysema and congestive heart failure is in cardiac arrest. His wife tells you that he collapsed about 5 minutes before your arrival. Your partner begins one rescue CPR as you prepare the AED. As you're applying the AED pads, the man's wife tells you that she wants you to let him die in peace. You should: comply with her request and cease all resuscitative efforts. Cease resuscitation only if the AED does not indicate a shock. Perform rescue breathing only and contact medical control. Continue performing CPR and ask her if he has a living will. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: when faced with a situation in which a family member does not wish for you to attempt resuscitation of a loved one, you should inquire about the presence of a living will or out of hospital do not attempt resuscitation OOH-DNR order. If a valid living will or OOH-DNR order is produced, it is generally acceptable to cease resuscitative efforts. Consult medical control as needed. If a valid living will or OOH-DNR order is not available, the most prudent action would be to continue CPR and contact medical control. Even in the absence of such documentation, medical control may advise you to cease resuscitation based on the wishes of the family and the patient's medical history. When in doubt, err on the side of the patient and attempt resuscitation. Few would argue that it is preferable to defend why resuscitation was attempted as opposed to why it was not. Flashcard 136. How does a unified incident command system differ from a single incident command system? In a unified incident command system, a single incident commander is identified and will function as such, regardless of the type of incident. In a unified incident command system, plans are made in advance by all agencies that assume a shared responsibility for decision-making. In a unified incident command system, one agency with several incident commanders has the majority of responsibility for incident management. In a unified incident command system, a single person is in charge of the entire incident, even if multiple agencies respond to the scene. Think of the answer before the reveal. The answer is: the correct answer is B. Reason: regardless of the type of incident command system ICS used, a single incident commander IC must be in charge. In a unified incident command system, plans are drawn up in advance by all cooperating agencies that assume a shared responsibility for decision-making. The response plan should designate the lead and support agencies for several types of mass casualty incidents (MACIS). For example, the hazmat team will take the lead in a chemical leak, and the medical team will take the lead in a multi-vehicle car crash. Large MCIs often require a unified incident command system. A single incident command system is one in which one person is in charge, even if multiple agencies respond to the scene. It is generally used with incidents in which one agency has the majority of responsibility for incident management. Ideally, it is used for a short duration, limited incidents that require the services of a single agency. Flashcard 137. After arriving at a mass casualty incident where other ambulances are already present, you should notify the dispatcher and then initiate care for the most critically injured patients. Obtain information from the fire service commander. Repeat the triage process. Report to the staging area. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: once you arrive at the scene of a mass casualty incident where an incident command system has already been established, you should report to the staging area, the area designated for all incoming ambulances and resources. The staging officer will know where help is needed the most and will be able to direct your actions accordingly. Flashcard 138. You are caring for a 6-year-old child with a swollen, painful deformity to the left forearm. As you communicate with the parents of this child, you should: make sure that they remain aware of what you are doing. B: tell them that the child will be transported to the hospital. C: ask them repeatedly how the child was injured. D: use appropriate medical terminology at all times. Think of the answer before the reveal. The answer is, you selected A. This is correct. Reason: when caring for any patient, it is important to keep both the patient and family aware of what you are doing. You should avoid medical terminology whenever possible because most laypeople will not understand what you are saying. The plain English approach is much more effective. When caring for children specifically, you should inform the parents of the need for ambulance transportation and why. Doing so will provide them with the information necessary to make an informed decision. Asking the parents repeatedly how the child was injured may be construed by some as implying that the child was abused. Flashcard 139. You arrive at the scene where a man fell approximately 40 feet and landed on his head. He is unresponsive, has adenal gasps, and a weak carotid pulse. Further assessment reveals an open head injury with exposed brain matter. Upon identifying this patient as an organ donor, you should recognize that the patient's injuries disqualify him as an organ donor. B: manage the patient aggressively and provide rapid transport. C: provide rapid transport only because the patient likely will not survive. D: request authorization from medical control not to initiate care. Think of the answer before the reveal. The answer is, the correct answer is B. Reason: it is unlikely that the patient will survive his injury. However, he is still breathing, albeit very poorly, and has a weak carotid pulse. Therefore, you should begin immediate and aggressive treatment and transport him promptly, just as you would for any other critically injured patient. It would clearly be inappropriate to request authorization to provide no care at all. If it is determined by a physician that he will not survive his injury, his organs can potentially be harvested and save several lives. Flashcard 140. According to the United States Department of Transportation (USDOT), minimum staffing for a basic life support ambulance includes at least 2 EMTs in the patient compartment. B: a minimum of 2 EMTs in the ambulance. C: an EMT who functions as the driver. D: at least 1 EMT in the patient compartment. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: the United States Department of Transportation (USDOT) requires at least 1 EMT in the patient compartment of a basic life support (BLS) ambulance. Although the driver does not have to be an EMT, it is preferable. Regardless, the person operating the ambulance must be able to safely and effectively operate an emergency vehicle. Regulations regarding minimum staffing of an ambulance vary from state to state. Flashcard 141. When is it most appropriate to complete your patient care report for a critically ill or injured patient? Promptly after the primary assessment. B: as soon as all patient care activities are completed. C: after the ambulance has been restocked at the station. D: any time before you arrive at the hospital. Think of the answer before the reveal. The answer is, you selected B. This is correct. Reason: patient care activities, especially when the patient's condition is critical, take priority over the completion of your patient care report (PCR). Once all patient care activities have been completed, you can complete the PCR. This is usually accomplished at the hospital or immediately upon returning to quarters. Flashcard 142. While functioning at a large-scale terrorist incident, it is important for the EMT to use triage and base patient care on available resources. B: avoid placing any casualty in a delayed treatment status. C: identify the person or persons responsible for the event. D: begin immediate treatment of the most critically injured. Think of the answer before the reveal. The answer is, you selected A. This is correct. Reason: during a terrorist incident, the basic foundations of triage and patient care remain the same. However, the treatment can and will vary. Terrorist incidents can produce a single casualty, hundreds of casualties, or thousands of casualties. When presented with widespread mass casualties, you must remember situational awareness. What you do in one situation may not be appropriate for another situation. In large-scale terrorist incidents, it is important to use triage and base patient care on available resources. When triaging casualties, use the same triage process that you would for any other mass casualty incident. Remain focused on providing the greatest good for the greatest number of people, not the person or persons responsible for the incident. Flashcard 143. As you step out of the ambulance at the scene of a nighttime motor vehicle crash on the highway, your most immediate concern should be the presence of oncoming traffic. B: whether the car will catch on fire. C: rapid assessment of all injured patients. D: placing safety flares by the ambulance. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: nighttime traffic crashes, especially those that occur on a highway, pose a significant risk to the safety of the EMT. Therefore, immediately upon exiting the ambulance, the concern for oncoming traffic should be at the front of the EMT's mind. Drivers can be blinded by all of the emergency lighting and not inadvertently veer off of the road and strike the rescuer. Safety flares are used less commonly than in the past. They have been known to blow off the road and start grass fires or ignite gasoline leaking from a vehicle. Reflective cones or triangles are safer and are used more often than flares. After ensuring your own safety, which includes notifying the fire department if the vehicle is leaking gas, you should then proceed to the patients. Flashcard 144. Which of the following is an example of the EMT providing care based on standing orders? Following assessment of a patient with a terminal illness, the EMT notifies the patient's personal physician to determine whether he or she requires any special care. B: the EMT defibrillates a patient with the automated external defibrillator, directs immediate resumption of CPR, and then contacts medical control for further guidance. C: after confirming that a patient's blood pressure is adequate, the EMT contacts medical control and requests permission to assist the patient with his prescribed nitroglycerin. D: prior to administering oral glucose to a patient with hypoglycemia, the EMT confirms the proper dosage and requests authorization from the base station physician. Think of the answer before the reveal. The answer is: the correct answer is B. Reason: standing orders define certain treatment interventions that the EMT is authorized to perform prior to contacting medical control. For example, the EMT knows that a cardiac arrest patient requires CPR, cardiac rhythm analysis with the AED, and defibrillation if indicated. Contacting medical control before performing these crucial interventions would only waste time and increase the chance of a negative patient outcome. Standing orders generally apply to interventions that the patient requires in order to prevent immediate death. Follow your local protocols regarding which interventions you are authorized to perform prior to contacting medical control. Flashcard 145. The role of triage officer at a mass casualty incident should be assumed by the first EMS provider who is willing to perform the task. B: EMS medical director via telephone communication. C: most knowledgeable EMS provider. D: EMS provider with the most years in EMS. Think of the answer before the reveal. The answer is: the correct answer is C. Reason: the role of triage officer should be assumed by the most knowledgeable EMS provider at the scene. Knowledge and experience will enable this person to most effectively manage the triage process. Just because a person has been in the EMS profession for a long period of time does not mean that he or she has been active or has maintained clinical competence. Flashcard 146. You are giving a presentation to a group of laypeople on the importance of calling EMS immediately for cardiac arrest patients. What point should you emphasize the most? Laypeople are incapable of providing adequate CPR. B: CPR and defibrillation are key factors in patient survival. C. Cardiac drug therapy is the most important EMS treatment. D. Rapid transport significantly reduces patient mortality. Think of the answer before the reveal. The correct answer is B. Reason: early high-quality CPR and defibrillation are the most crucial initial treatments to provide to a patient in cardiac arrest. Adequately performed CPR can keep the heart and brain oxygenated, thus increasing the chance of defibrillation success. Ventricular fibrillation (VFib) is the most common initial dysrhythmia seen in adult patients with sudden cardiac arrest and requires prompt defibrillation. Untreated VFib will rapidly deteriorate to a systole, the mortality rate from which is very high. You should also advise the audience that compression-only CPR has been linked to patient survival. Flashcard 147. Which of the following vaccinations is not currently recommended by the Centers for Disease Control and Prevention (CDCs)? A: tetanus, diphtheria, and pertussis. B: measles, mumps, rubella. C: hepatitis B. D: smallpox. Think of the answer before the reveal. The correct answer is D. Reason: immunization requirements are usually set by the State Department of Health, but generally follow recommendations made by the Centers for Disease Control and Prevention (CDC). Recommended immunizations for healthcare providers include tetanus, diphtheria, and pertussis Tdap. D-TOP boosters every 10 years, measles, mumps, rubella MMR booster, influenza vaccine yearly, and hepatitis B vaccine single or 3 shots series. Smallpox vaccinations ceased in 1972 after the World Health Organization, who officially declared the disease eradicated. Flashcard 148. Which of the following creates a secure loop at the working end of a rope, which can be used to attach the end of the rope to a fixed object or a piece of equipment? A: half hitch. B: figure 8 knot. C: clove hitch. D: figure 8 on a bite. Think of the answer before the reveal. The correct answer is D. Reason: although EMTs infrequently perform special rescue operations, i.e., urban search and rescue (USAR), they should have a basic working knowledge of the different ropes and knots used for rescue purposes. The figure 8 on a bite knot creates a secure loop at the working end of the rope, the part of the rope used for forming the knot. This loop can be used to attach the end of the rope to a fixed object or a piece of equipment, or to tie a life safety rope around a person. The loop may be of any size, from an inch to several feet in diameter. The figure 8 is a basic knot used to produce a family of other knots, including the figure 8 on a bite and the figure 8 with a follow-through. A simple figure 8 knot is seldom used. The half hitch is not a secure knot by itself, which is why it is used in conjunction with other knots. The clove hitch is used to attach a rope firmly to a round object, such as a tree or fence post. Flashcard 149. Most crashes involving ambulances occur: A: at intersections. B: at stop lights. C: at stop signs. D: on the highway. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: intersection crashes are the most common and usually the most serious type of collision in which ambulances are involved. When approaching an intersection, you should come to a complete stop, look in both directions for pedestrians and other motorists, and then proceed with caution. Remember, your lights and siren do not give you the right-of-way. They ask other motorists for the courtesy of the right-of-way. If you proceed through an intersection without stopping and strike another vehicle that had the right-of-way, you will be held liable. Whether or not your lights and siren were in use at the time of the incident is irrelevant. Flashcard 150. While you are inside a crashed vehicle assessing a patient who is entrapped, the rescue team should be: A: actively extricating the patient using whichever extrication method they deem necessary. B: preparing for a simple extrication process since you are obviously able to access the patient. C: awaiting specific instructions from you as to how to proceed with the extrication process. D. Assessing exactly how the patient is trapped and determining the safest way to extricate. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: your ability to access the patient with or without difficulty does not indicate the extent of entrapment or method of extrication necessary. The EMT's job is to assess and treat the patient. The rescue team's job is to determine the degree of entrapment and decide how to extricate. As you are assessing the patient, providing any care that you can within the confines of the vehicle, the rescue team should be assessing the vehicle and the degree of patient entrapment. This will enable them to determine the safest, most effective extrication approach. It is critical for the EMT in the vehicle and the rescue team outside the vehicle to constantly communicate. Once the patient has been assessed and provided any immediate life-saving care, and the rescue team has determined the best extrication approach, extrication can begin. Flashcard 151. You are the first ambulance to arrive at the scene of a motor vehicle crash. As you approach the scene, you see 3 patients, 2 who have been ejected from their vehicles and the other who is still in his vehicle. You should notify the local trauma center so they can prepare for the patients. B: call medical control and apprise him or her of the situation. C: request additional ambulances to respond to the scene. D: begin triaging and treating the most critically injured. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: one of the most important aspects of the scene size-up is to determine the need for additional resources. A single EMS unit and 2 EMTs cannot effectively manage 3 patients, especially if they are critically injured. Therefore, you must first request additional ambulances at the scene. After requesting additional resources, begin the processes of triage and treatment. Notify the local trauma center early, if possible, so they can prepare to take care of the patients. However, your first priority is to maximize patient care at the scene by requesting additional ambulances. Flashcard 152. When called to the scene of a structural fire to stand by in case any injuries occur at the scene, you should depart the scene and return to service after the fire has been completely extinguished. B: enter the structure with the firefighters so you can provide immediate care to any victims. C: park the ambulance close to the fire so you can rapidly access any patients. D: ensure that your ambulance does not block or hinder other arriving fire apparatus. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: when standing by at the scene of a structural fire, you must ensure that the ambulance is parked at a safe distance. This will not only keep you safe from the fire itself, but also minimize your risk of injury if the structure collapses. You must also ensure that the ambulance does not block or hinder access to the fire by fire apparatus that arrives after you. You should receive instructions from the fire officer in charge regarding the appropriate location to park the ambulance. It is not the EMT's job, nor is it safe, to enter a structure fire. If victims are located by firefighters, they will be brought to you. Do not depart the scene and return to service until the fire officer in charge releases you. Many dangers still exist after the fire has been extinguished. Flashcard 153. When calling your radio report to the receiving hospital, you should include the patient's name. B: break your report into 60-second increments. C: only give your report to a physician. D: be brief, concise, and factual. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: a radio report should be brief, concise, and factual. It should include the patient's age and sex, his or her chief complaint, associated assessment findings, vital signs, treatment that you provided, and the patient's response to your treatment. Avoid speculative statements regarding the patient's condition. Report only what you know to be fact. Longer radio reports should be broken into 30-second increments. After 30 seconds, pause and ensure the listener heard your previous traffic. The patient's name is not vital to your report. Thus, there is generally no need to disclose it. Unless you are requesting medical direction, it is acceptable and routine practice to give your report to a registered nurse. Flashcard 154. Following a call in which a 6-week-old infant in cardiac arrest did not survive, your partner is exhibiting significant anxiety and irritability. How can you most effectively help him? A: report his behavior to the medical director. B: tell him that he needs psychiatric help. C: recommend at least 12 hours of sleep. D: allow him to voice his feelings to you. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: your partner is clearly having difficulty coming to terms with this call's bad outcome. As his partner, you can be most effective during this time by simply listening and allowing him to voice his feelings. Bad feelings should never be kept bottled up. If your partner is still having difficulties, a formal critical incident stress debriefing SIST may be needed. Some EMS providers may require psychiatric or psychologic assistance. However, this is not a determination that you can make. At least 8 hours of sleep is healthy. However, in the face of a crisis, sleep does not make the problem go away. Flashcard 155. Medical control has ordered you to administer 1 tube of oral glucose to a hypoglycemic patient. Immediately after receiving this order, you should: ask medical control to repeat the order word for word. B: repeat the order back to medical control word for word. C: document the order on the pre-hospital care report. D: administer the medication and reassess the patient. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: immediately after receiving an order from medical control, you should repeat the order back to medical control word for word. This will ensure that you heard correctly and understand the order to be carried out. If you receive an order that seems inappropriate, you should ask the physician to repeat the order back to you for clarification. Reassess the patient after administering the medication and document the time and patient's response, good or bad, on your patient care report. Flashcard 156. Your actions at the scene of a critically injured patient who was shot during a robbery should include: A: caring for the patient while manipulating the scene minimally. B: performing a primary assessment only. C: providing care when the police authorize you to. D: starting immediate care as you would with any other patient. Think of the answer before the reveal. The answer is: the correct answer is A. Reason: after ensuring your own safety. Your priority while functioning at a crime scene is to provide care to the patient. However, you should make a reasonable effort to avoid manipulating the scene in order to preserve potential evidence. If furniture or other objects do not need to be moved to gain access to the patient and provide adequate working space, they should be left in place. Conversely, if any obstacles impede your care of the patient, they must be moved as needed. Seeking law enforcement approval before treating a critically injured patient would clearly waste valuable time. Flashcard 157. A conscious and alert 92-year-old woman with chest pain is refusing EMS treatment and transport to the hospital. Her family insists that you transport her. This situation is most appropriately managed by: A: transporting the patient as the family wishes. B: obtaining a signed refusal from a family member. C: transporting the patient as you explain your actions. D: advising the patient of the risks of refusing care. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: just because the patient is 92 years old does not mean that she does not have decision-making capacity and cannot make an informed decision. In cases where any patient refuses care, after determining that the patient has decision-making capacity, i.e., is of legal age, is not impaired by drugs or alcohol, you must inform the patient of the potential risks of refusing care, namely death. If the patient is aware of and willing to accept the potential consequences of his or her refusal, a refusal of treatment and / or transport form should be signed by the patient. A non-biased witness, i.e., law enforcement officer, emergency medical responder EMR, should also sign the refusal form. Flashcard 158. The technique of rapid extrication from a vehicle involves manually stabilizing the head, applying a cervical collar, and removing the patient from the vehicle onto a long backboard. Grabbing the patient by his or her clothing, protecting his or her spine as much as possible, and dragging him or her from the vehicle. Applying a cervical collar, grasping the patient by the clothing and quickly removing him or her onto the stretcher. Applying a vest-style extrication device, sliding a long backboard under the patient's buttocks, and removing him or her from the vehicle. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: the rapid extrication technique is indicated if the patient has life-threatening injuries and / or is in need of treatment that requires a supine position. It is performed by manually stabilizing the patient's head. An EMT in the backseat typically does this, applying a cervical collar, sliding a backboard under the patient's buttocks, and removing him or her from the vehicle and onto the backboard. The vest-style extrication device is not appropriate to use when performing the rapid extrication technique. It takes too long to correctly apply. Do not confuse the rapid extrication technique with an emergency move. An emergency move, which is indicated if you or the patient's safety is in imminent danger, involves grabbing the patient by the clothing, protecting his or her spine as much as possible, and dragging him or her from the vehicle to a safe place. Flashcard 159. A man armed with a shotgun has taken 2 people hostage and has shot one of them. Upon arriving at the scene, you should be sure and turn up your portable radio loud enough so that you can remain aware of the entire situation. Have the incident commander guide you to a shielded staging area and wait for the tactical team to bring the patient to you. Leave your lights and siren on because this will let the injured person know that you have arrived and are there to help. Inform the incident commander that you will assume responsibility for the entire incident since there is a confirmed patient. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: upon arriving at the scene of a tactical situation, such as a hostage situation, the presence of a sniper, or any exchange of gunfire, you should report to the incident commander, who will take you to a shielded, safe staging area that has been selected for the ambulance and for treatment of casualties. Remain there until the tactical team brings the patient or patients to you. As an EMT, you are responsible for patient care once the patient has been brought to you. You are not in charge of the entire incident. When you arrive at the scene, turn your lights and siren off to avoid agitating the gunman. You should also keep your portable radio turned down and minimize radio traffic. If possible, use an ear speaker. Flashcard 160. All of the following are considered key components at the scene of a mass casualty incident, except an adequately staffed treatment area. A supply area near the treatment area. An on-scene emergency physician. An on-site communication system. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: on-site communications, an adequately staffed treatment area, and a supply area near the treatment area are some of the key components at a mass casualty incident. Although the physician medical director is ultimately responsible for all patient care activities at the scene, he or she typically communicates with the incident commander via mobile phone or two-way radio from the base hospital. Physical presence of the physician at the scene, although optimal, is often not possible. Flashcard 161. The most effective means of preventing the spread of disease is wearing a mask with all patients. Effective hand washing. Wearing gloves with all patients. Up-to-date immunizations. Think of the answer before the reveal. The answer is: You selected B. This is correct. Reason: according to the Centers for Disease Control and Prevention (CDC), the most effective way of preventing the spread of disease is to frequently and effectively wash your hands, especially in between patients. The regular use of gloves with all patients and wearing a mask when managing a patient with a communicable disease, i.e., tuberculosis, will decrease your chance of disease exposure. Remaining up to date with your immunizations will reduce your risk of contracting certain diseases if you're exposed. Flashcard 162. The information that would be of least pertinence when educating the public on injury prevention is A: how to provide rescue breathing. B: teaching children to wear bicycle helmets. C: the proper usage of child safety seats. D: building a child-proof fence around a pool. Think of the answer before the reveal. The answer is, you selected A. This is correct. Reason: the goal of an injury prevention program is just that, prevention. If rescue breathing is needed in a situation, the injury has already occurred. As AMS providers, we are consequence managers. Additionally, we have a responsibility to educate the public on how to avoid injuries in the first place. Flashcard 163. While en route back to your station from the emergency department, you discover that you forgot to include vital patient information on the front of your patient care report (PCR). Having left a copy of your PCR with the emergency department staff, you should notify the emergency department staff and advise them of your error. B: document the information on the front of your original PCR. C: include the information on an addendum and furnish it to the hospital. D: do nothing, since you already left a copy of the PCR at the hospital. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: once you leave a copy of your patient care report PCR with the hospital staff, you should not add information to the front of the report. If you discover that you forgot to include vital patient information, you should document the information on a separate addendum and furnish it to the emergency department, which can be sent by fax. The copy of your PCR you leave at the hospital and the original PCR should contain the same information. Adding information to the front of the PCR after leaving a copy at the hospital makes the copy and original two separate documents. Flashcard 164. You have completed your patient care report and left a copy at the hospital when you realize that you forgot to document a pertinent finding on the front of the report. You should take no action and report the event to your supervisor. B: attach an addendum to the original run report. C: complete a new run report and add the information. D: write the information on the original run report. Think of the answer before the reveal. The answer is, you selected B. This is correct. Reason: if you discover that you forgot to include pertinent information on your patient care report PCR after leaving a copy at the hospital, you should write the information on a separate addendum and attach it to the original PCR. A copy of the addendum also should be sent to the receiving facility. Once you leave a copy of your PCR at the hospital, you should not add anything to the original. Legally, this would result in two different records for the same patient. Many EMS systems use electronic PCR, (ePCR) software, in which case the PCR is electronically submitted to the receiving facility upon completion. As with the handwritten PCR, you should add an addendum to the ePCR if you forget to include pertinent information on the original. Flashcard 165. While treating a patient in cardiac arrest, you turn the AED on and attach the pads to the patient. However, when the AED begins to analyze the patient's cardiac rhythm, it signals low battery and then shuts off. The patient subsequently died. Which of the following statements regarding this scenario is most correct? A: you and your partner may be held liable for negligence. B: the crew that preceded you may be held liable for negligence. C: most errors associated with the AED involve equipment failure. D: the manufacturer of the AED will be held liable for negligence. Think of the answer before the reveal. The answer is, you selected A. This is correct. Reason: the most common errors that occur with the EED are the result of operator error, not equipment failure, usually because no one made sure that the batteries were fully charged when checking the ambulance at the start of the shift. Because the patient died, you and your partner could be held liable for negligence. Remember, the entire ambulance must be checked by the oncoming shift to ensure that all equipment is functional and that all supplies are present. Even though the preceding crew is morally responsible for not replacing the batteries, the legal ramifications will rest on you and your partner's shoulders. Flashcard 166. When providing care to multiple patients at the scene of a mass casualty incident, your goal should remain focused on A: transporting patients to the hospital. B: keeping all bystanders at a safe distance. C: initiating CPR for those in cardiac arrest. D: immobilizing all patients at the scene. Think of the answer before the reveal. The answer is, you selected A. This is correct. Reason: at the scene of mass casualty incident, you will be faced with many challenges, including ensuring your safety, extrication, triage, and patient care. In the midst of all of these activities, however, you must never lose sight of your ultimate goal, which is to transport all patients to the hospital as soon as possible. Flashcard 167. You arrive at the scene of an 80-year-old woman who is weak and lightheaded. Her son, who called 911, is present and asks you to transport his mother to the hospital. You should A: assess the woman and determine if she wishes to be treated and transported. B: comply with the son's request and transport the woman to the hospital. C: advise the son that he can probably drive his mother to the hospital. D: take the woman's vital signs and apply supplemental oxygen if necessary. Think of the answer before the reveal. The answer is, you selected A. This is correct. Reason: you must obtain consent from any mentally competent adult patient prior to initiating treatment. Just because the patient is 80 years old does not mean that she does not have decision-making capacity. And just because her son wants her to be transported does not mean that she does. Ask her if she wishes to be treated and transported to the hospital. If she does, then you have obtained consent and should proceed accordingly. If she does not, you should determine if she has decision-making capacity, that is, whether or not she is mentally competent. If she is determined to have decision-making capacity, then you cannot legally treat or transport her. If she does not have decision-making capacity, for example, she is confused, under the influence of drugs or alcohol, then you may treat and transport under the law of implied consent. It is not the EMT's decision to determine, let alone recommend, that a patient be taken to the hospital via privately owned vehicle POV. If the patient requests EMS treatment and transport, you are legally obligated to do so. Flashcard 168. Which of the following actions demonstrates an EMT's knowledge of crime scene preservation? A: carefully cutting through the hole in a patient's clothing that was made by a large caliber firearm. B: requesting approval from law enforcement before controlling severe bleeding from a patient's arm. C: advising a law enforcement officer after moving a coffee table to access a critically injured patient. D: placing a knife in a plastic Ziploc bag and giving it to a law enforcement officer for safekeeping. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: after ensuring your own safety, your priority when caring for a patient at a crime scene is to do just that, care for the patient. If you need to move a piece of furniture to gain access to a critically injured patient, move the furniture, treat the patient, and then advise a law enforcement officer of what you moved and where you moved it to. In this way, you are providing immediate care to the patient, but are remaining aware that the location of any obstacles between you and the patient may serve as evidence. Clearly, you are not going to request approval from a law enforcement officer before treating a critically injured patient. Items that may have fingerprints on them, such as knives or guns, should be placed in a paper bag, Condensation can accumulate in plastic bags, potentially destroying any evidence. When removing clothing from a gunshot victim, you should make an effort to cut around, not through the hole in the clothing that was made by the bullet. The hole in a patient's clothing may contain gunshot residue and can provide valuable information regarding the type of weapon used and the distance between the assailant and the victim. Flashcard 169. While caring for an emotionally disturbed 30-year-old male, he suddenly becomes violent and needs to be physically restrained. During the restraint procedure, you should approach the patient from the front and converge on him quickly. Maintain communication with him and closely monitor his airway. Ensure that at least 3 people are available to safely restrain him. Place him in a prone position and secure straps across his back. Think of the answer before the reveal. The correct answer is B. Physical restraint may be necessary if a patient is a threat to him or herself or others. If it becomes necessary to physically restrain a violent patient, there are certain specific guidelines that must be followed. Use a minimum of 4 people to restrain the patient, 1 assigned to each extremity. Approach the patient from the front and the sides. This will prevent him or her from getting away from you. Somebody, preferably you or your partner, should talk to the patient throughout the restraint process even if the patient is not listening to you. Never restrain a patient face down prone. It is impossible to adequately monitor the patient, and this position may inhibit the breathing of an impaired or exhausted patient. Positional asphyxia. Use just enough force to effectively restrain the patient. The patient's gender, body size, strength, and mental status can be used to determine the appropriate amount of force. Reassess airway and breathing continuously regardless of the patient's position and continue to talk to him or her during transport. Flashcard 170. The safest emergency vehicle operator is one who has a positive attitude. B is physically fit. C drives with lights and siren. D drives with due regard. Think of the answer before the reveal. The answer is, you selected D. This is correct. One of the most important attributes of a safe emergency vehicle operator is the ability to drive with due regard for others. This means that the operator must be aware of others around him or her and to keep their safety in mind. The EMT should never assume that all drivers will see or hear the ambulance. A positive attitude about one's ability to safely operate an emergency vehicle is also an important attribute. Although sometimes indicated for the patient's condition, the use of lights and siren increase the risk of an ambulance crash. Flashcard 171. The immobilization device most appropriate to use for a patient with multiple injuries and unstable vital signs is the long spine board immobilization device. B short spine board immobilization device. C vest style immobilization device. D scoop immobilization device. Think of the answer before the reveal. The answer is, you selected A. This is correct. When caring for a critically injured patient with multiple injuries, the patient's entire body should be immobilized. This is most quickly and effectively accomplished using a long spine board. Vest-style devices or short spine boards take too long to apply and will not provide full-body immobilization. The scoop orthopedic stretcher is effective for maneuvering patients in narrow spaces, but will not allow for full spinal immobilization because of the vertical opening down the center of the device. Flashcard 172. When driving in emergency mode on a multi-lane highway, the emergency vehicle operator should keep to the right shoulder so that traffic flow is not disrupted. B extreme right lane so motorists can yield to the left. C extreme left lane so motorists can yield to the right. D center lane so the traffic can flow around the ambulance. Think of the answer before the reveal. The answer is, you selected C. This is correct. When traveling on a highway with more than one lane, The emergency vehicle operator should remain in the extreme left-hand fast lane. This allows other motorists to yield to the right as they see you approach. A motorist's typical initial reaction is to slam on their brakes and then look for the best direction to yield. This may be to the left or right, depending on the traffic. Do not attempt to pass a motorist until he or she is clearly aware of your presence and has yielded accordingly. Passing other motorists on the right is unsafe and should be avoided. Flashcard 173. When using the power lift to lift a stretcher, you should ensure that you lift with your palms facing up. Place your hands palms down on the stretcher. Maintain a slight inward curve to your back. Bend at the waist and keep your back straight. Think of the answer before the reveal. The answer is, you selected A. This is correct. Reason: in order to achieve the best grip and to avoid injury to your wrists, you should lift a stretcher, backboard, or other carrying device with your palms facing up. Do not bend at the waist, bend at the knees and keep your back in a straight, locked-in position. Flashcard 174. A 52-year-old woman crashed her minivan into a tree. She is pinned at the legs by the steering wheel and is semi-conscious. After gaining access to the patient, you should have the fire department disentangle the patient and quickly remove her from the car. Perform a primary assessment and provide any life-saving care before extrication. Rapidly assess her from head to toe, obtain vital signs, and apply a cervical collar. Immediately apply high-flow oxygen to the patient and allow extrication to begin. Think of the answer before the reveal. The answer is, you selected B. This is correct. Reason: unless there is an immediate threat of fire, explosion, or other danger, you should perform a primary assessment and begin any life-saving care as soon as you have gained access to the patient. If you wait to do this until after the patient has been disentangled, it may be too late. The patient may already be dead. After you have assessed the patient and treated any immediate threats to life, allow extrication to commence. Once the patient has been freed from the vehicle, continue any life-saving care and perform a rapid head-to-toe assessment to identify and treat other life-threatening injuries. Another EMT can obtain vital signs as you rapidly assess the patient. Prepare for immediate transport after the rapid head-to-toe assessment has been performed and the appropriate spinal precautions have been taken. Flashcard 175. Which of the following is the most practical method of standard precautions when treating multiple patients during a mass casualty incident? Asking each patient you treat if he or she has a communicable disease. Placing clean gloves over soiled gloves in between patient contacts. Thoroughly washing your hands in between patient contacts. Changing your gloves in between contact with different patients. Think of the answer before the reveal. The answer is, you selected D. This is correct. Reason: although the most effective means of preventing the spread of disease involves thorough hand washing, this is not practical at the scene of a mass casualty incident. You usually do not have the time or facilities to do this. In a situation where you are treating multiple patients, you should change your gloves in between patients. This will help prevent cross-contamination. The concept of standard precautions is based on the assumption that all bodily fluids are potentially infectious. Thus, there is no need to ask a patient if he or she has a communicable disease. Furthermore, to make such an inquiry is unethical. Flashcard 176. Upon arriving at a scene in which a tanker truck overturned and is spilling an unknown liquid on the ground, you should quickly identify the material. Turn off your warning lights. Park upwind from the scene. Stay downhill from the scene. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: at the scene of a potential or actual hazardous materials incident, you should park the ambulance in an area that is both upwind and uphill from the incident. However, you must be prepared to quickly relocate if the wind direction changes. Staying uphill is important because many hazardous materials collect in low-lying areas such as valleys. After ensuring that you are in a safe place, attempt to identify the chemical involved by reading the placard on the tanker with binoculars and referencing the placard number in the Emergency Response Guidebook (ERG). Flashcard 177. Who has ultimate authority for all issues regarding patient care at the scene of a mass casualty incident? A: Incident Commander. B: Most experienced EMT. C: EMS Medical Director. D: Treatment Officer. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: the Incident Commander IC is responsible for all logistical and operational aspects of a mass casualty incident MCI, such as designating section officers and working in conjunction with other agencies, for example, police, fire, EMS. For all issues regarding patient care, the EMS Medical Director has ultimate authority. Although the treatment officer is responsible for overseeing all emergency care provided at the scene, and EMTs working in the treatment area are providing direct patient care, these personnel are still functioning under the physician's license. During an MCI, the IC or his or her designee is typically in contact with the medical director, who is located at the base station hospital, via mobile phone or two-way radio. In some cases, the medical director may be physically present at the incident. Flashcard 178. Following an apparent terrorist attack, numerous patients present with shortness of breath and persistent coughing. A green haze is noted in the area in which the patients are located. Which of the following agents should you suspect they were exposed to? A: tabun GAB: phosgene oxime. C: V agent VXD: chlorine Cl. Think of the answer before the reveal. The answer is: the correct answer is D. Reason: the patient's signs and symptoms are indicative of a pulmonary choking agent, specifically chlorine Cl. Chlorine Cl was the first chemical agent ever used in warfare. It has a distinct odor of bleach and creates a green haze when released as a gas. Initially, it produces upper airway irritation and a choking sensation. Later signs and symptoms include shortness of breath, chest tightness, hoarseness and stridor as the result of upper airway swelling and gasping or persistent coughing. Phosgene, not to be confused with phosgene oxime, a blistering vesicant agent, is also a pulmonary choking agent. Tabun GA and V agent VX are examples of chemical nerve agents. Nerve agents are among the most deadly chemicals developed. Designed to kill large numbers of people with small quantities, nerve agents can cause cardiac arrest within seconds to minutes of exposure. Flashcard 179. Upon arriving at the scene of a crash involving a large truck, you immediately note the presence of an orange placard on the side of the tank that the truck is pulling. This indicates that the vehicle is carrying a slash and blank agent. A: explosive. B: flammable. C: corrosive. D: radioactive. Think of the answer before the reveal. The answer is: the correct answer is A. Reason: the color of a warning placard indicates the general classification of agent being carried, while the United Nations UN number in the center of the placard indicates the exact agent being carried. For example, a red placard bearing the UN number 1203 indicates gasoline, red indicates the classification flammable, and 1203 indicates the exact agent gasoline. Orange placards indicate explosive or blasting agents, placards that are half yellow and half white indicate radioactive agents, and black placards indicate corrosive agents. Use your emergency response guidebook and binoculars if appropriate to identify both the classification and exact agent involved. Flashcard 180. After assisting a patient with her epinephrine autoinjector, you should: A: place the device in a puncture-proof container. B: place the device in a red biohazard bag. C: give it to the patient to have it refilled. D: replace the cover and place it in the trash can. Think of the answer before the reveal. The answer is: You selected A. This is correct. Reason: after any device is used that has the potential for causing an accidental needle stick or is otherwise contaminated, it should be placed in a puncture-proof container, which usually is red and has a biohazard logo on it. The cover of the auto-injector should never be replaced, nor should a needle be recapped. Epinephrine auto-injectors are not refillable. Flashcard 181. In most states, the EMT is required to report which of the following occurrences: A: animal bite. B: motor vehicle crash. C: injury to a minor. D: drug overdose. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: although each state may have slightly differing reporting laws, most require the EMT to report cases such as child or elderly abuse, sexual assault, animal bites, and injury that occurs during the commission of a crime. Injury to a minor is typically not a reportable case unless abuse is suspected. Motor vehicle crashes and drug overdoses are not reportable cases either, unless they occur during the commission of a crime. Flashcard 182. A patient presents with severe bradycardia, hypersalivation, vomiting, and excessive tearing. Which of the following agents would most likely cause his signs and symptoms? A: phosgene. B: chlorine. C: summon. D: anthrax. Think of the answer before the reveal. The answer is: the correct answer is C. Reason: nerve agents, for example, V agent VX, sarin GB, summon GD, tabun GA are among the most deadly chemicals developed. Designed to kill large numbers of people with small quantities, nerve agents can cause cardiac arrest within seconds to minutes of exposure. Nerve agents, discovered while in search of a superior pesticide, are in a class of chemical called organophosphates, which are found in household bug sprays, agricultural pesticides, and some industrial chemicals. Organophosphates block an essential enzyme in the nervous system, which cause the body's organs to become overstimulated. The mnemonic dumbbells can help you recall the signs and symptoms of nerve agent exposure. It stands for diarrhea, urination, meiosis constricted pupils, bradycardia, emesis vomiting, lacrimation excessive tearing, and seizures, salivation, and sweating. You can also use the mnemonic SLUGM, which stands for salivation, lacrimation, urination, defecation, GI distress, emesis, and meiosis. Flashcard 183. Which of the following statements regarding the use of an escort vehicle when en route to an emergency call is correct? A: an escort vehicle will allow you to arrive at the scene quicker. B: an escort vehicle should be used only if you are unfamiliar with the patient's location. C: to avoid getting separated from the escort vehicle, you should closely follow it. D: with an escort vehicle, the risk of an accident at an intersection is reduced significantly. Think of the answer before the reveal. The answer is: the correct answer is B. Reason: generally, escort vehicles should not be used when responding to an emergency scene. The biggest danger of using an escort occurs at intersections, which is where most ambulance crashes occur. Drivers may yield to the escort vehicle, but may not be prepared for a second vehicle following the escort wake effect collision. The only time that an escort may be required is when you are unfamiliar with the location of the patient and need assistance getting there. If an escort must be used, you must follow at a safe distance of at least 500 feet. Flashcard 184. You are dispatched to a call for an unresponsive patient. Which of the following is the most important information that you should initially obtain from the dispatcher? A: the exact location of the patient. B: whether or not the patient is breathing. C: the patient's sex and approximate age. D: the callback number of the caller. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: you should attempt to obtain as much patient information from the dispatcher as you can. However, in order to help the patient, you must know his or her location. Therefore, this is the most important initial question to ask. Once you determine where the patient is, you should then try to ascertain the sex and approximate age of the patient, whether or not he or she is breathing, and any other information that can help you prepare to provide care. The caller's phone number is generally not disclosed to the responding EMTs, although this is important information for the dispatcher to obtain. In many dispatch systems, the caller's phone number and location in some cases automatically appears on the computer screen when the 911 call is answered. Flashcard 185. Which of the following is considered minimum personal protective equipment PPE when suctioning an unresponsive patient's airway? A: gloves and a mask. B: gloves, gown and eye protection. C: gloves, head cover and eye protection. D: gloves and full facial protection. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: you should wear gloves when assessing or treating any patient. The level of personal protective equipment PPE used beyond gloves is dictated by the risk and type of exposure. When managing a patient's airway, for example, suctioning, ventilating with a bag mask device, you should use at a minimum gloves and full facial protection. This will protect you from oral and eye exposure if the patient coughs or vomits. A gown should be worn, in addition to gloves and full facial protection, anytime there is a risk of blood splatter. Examples of when this may occur include delivering a baby or caring for a combative patient with severe external bleeding. The level of PPE you use in a given situation should be guided by reasonable judgment and common sense. Flashcard 186. You are called to treat a 55-year-old man who is experiencing difficulty breathing. After making contact with your patient, he extends his arm out to allow you to take his blood pressure. This is an example of A: implied consent, B: formal consent, C: actual consent, D: informed consent. Think of the answer before the reveal. The answer is: the correct answer is C. Reason: actual consent, also referred to as expressed consent, is when the patient asks for your help outright. This may also include nonverbal gestures, such as extending the arm to you to allow you to take the blood pressure. Informed consent involves explaining your proposed treatment to the patient, including the potential benefits and risks of the treatment. Implied consent involves treating an unresponsive patient or minor child when the parents are not present based on the assumption that the patient or the parents of a minor would consent to emergency treatment. Flashcard 187. Which of the following components is not part of an injury or illness prevention program? A: teaching new parents how to properly install child safety seat. B: inspecting the home of young parents for child safety locks. C: educating teenage students on the dangers of drinking and driving. D: training a group of daycare employees on infant and child CPR. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: the operative word in injury and illness prevention is prevention. An injury or illness prevention program should focus on actions that prevent illness or injury. These include, but are not limited to, teaching new parents how to properly install a child safety seat, educating teenage students on the dangers of drinking and driving, and conducting a courtesy inspection of the home of young parents for the presence of child safety locks. Training laypeople on CPR. Although a valuable service, is not part of a prevention program. CPR is not needed until an injury or illness has already occurred. Flashcard 188. When the incident command system is activated at the scene, you should expect to A: report back to your section officer in between assignments. B: receive instructions and then function independently. C: be assigned one responsibility for the duration of the incident. D: be immediately directed to the established treatment area. Think of the answer before the reveal. The answer is: you selected A. This is correct. Reason: the Incident Command System ICS was established in order to maximize effective operations at the scene and maximize the number of lives saved. Deviation from the ICS jeopardizes lives and increases the risk of losing control over the situation. When you arrive at the scene in which the ICS has been activated, you should report to the staging area, where you will be directed to the area in which you are needed. Report to the section officer of that area, receive your instructions, and carry them out. When you have completed your assignment, you must return to the section officer for further instructions. Depending on the situation, you may be sent to another section. The sections that you work in and the responsibilities that you are given may change during the incident. At no time should you attempt to function independently freelancing. This defeats the purpose of the ICS and puts lives in jeopardy. Flashcard 189. While caring for an injured patient, you remove blood-soaked clothing in order to treat his injuries. You should dispose of the clothing by A: leaving it at the hospital. B: leaving it at the scene. C: placing it in a regular trash can. D: placing it in a biohazard bag. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: the appropriate method for disposing of soiled clothing or any other non-sharp contaminated item is to place it in a red biohazard bag. The biohazard insignia as well as the red color alerts others that the items within the bag are contaminated. Flashcard 190. During the triage process, which of the following injuries or conditions would classify a patient as a high priority? A: partial thickness burns with no respiratory difficulty. B: a large avulsion to the arm and an altered mental status. C: pulselessness and apnea. D: unilateral femur fracture and tachycardia. Think of the answer before the reveal. The answer is: the correct answer is B. Reason: during triage, patients with an altered mental status, who are in shock, or who have problems with airway, breathing, or circulation, are potentially salvageable and are given immediate priority. Patients who are pulseless and apneic have low priority in a mass casualty situation. If you focus your efforts on cardiac arrest patients, who will most likely not survive anyway, patients who could have potentially been saved will die as well. Remember, the goal of triage is to provide the greatest good for the greatest number of patients. Flashcard 191. The primary clinical feature associated with exposure to a vesicant agent is A: vomiting blood. B: muscle twitching. C: tachycardia. D: skin blistering. Think of the answer before the reveal. The answer is: you selected D. This is correct. Reason: the primary route of exposure of blister agents, or vesicants, is the skin. If vesicants are left on the skin or clothing long enough, they produce vapors that can enter the respiratory tract. Vesicants cause burn-like blisters to form on the victim's skin as well as in the respiratory tract if inhaled. Vesicant agents include sulfur mustard H, leucite L, and phosgene oxime CX. The symbols H, L, and CX are military designations. Vesicants usually cause the most damage to damp or moist areas of the body, such as the armpits, groin, and respiratory tract. Flashcard 192. You arrive at the scene of a traffic accident in which multiple vehicles are involved. You see at least 2 patients who are lying on the road and are not moving. You should A: begin triaging the patients. B: request additional ambulances. C: begin immediate patient care. D: notify medical control for advice. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: as soon as you determine that there are more patients than you and your partner can effectively manage, you should immediately request additional help. Waiting until you are overwhelmed with critically injured patients is not the time to call for help. When in doubt, it is best to call for help. You can always cancel any incoming ambulances if you later determine that they are not needed. After you have called for assistance, you should begin triaging and caring for the patients to the best of your ability. Flashcard 193. Proper guidelines for safe reaching include all of the following except keeping your back in a locked-in position. B: avoiding twisting of your back. C: reaching no more than 30 in front of your body. D: avoiding hyperextension of your back. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: safe reaching practices are critical to the prevention of a back injury. When reaching, you should keep your back in a locked-in position. You should avoid twisting or hyperextending your back, and should reach no more than 15 to 20 inches in front of your body. Flashcard 194. Which position is most appropriate for a mother in labor with a prolapsed umbilical cord? A: supine with legs elevated. B: left lateral recumbent. C: supine with hips elevated. D: left side with legs elevated. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: when the umbilical cord is prolapsed, the infant typically slides down the birth canal and rests on top of the cord, shutting off its own oxygen supply. Placing the mother supine with her hips elevated will cause the baby to slide back into the birth canal slightly, thereby relieving pressure off of the cord. It may be necessary to insert your gloved fingers into the mother's vagina and lift the baby's head off of the cord. Give the mother high-flow oxygen and transport without delay. A lateral recumbent on the side position is appropriate for pregnant women without a prolapsed cord and will help prevent the occurrence of supine hypotensive syndrome, a condition in which the pregnant uterus compresses the inferior vena cava and compromises cardiac output. Flashcard 195. Which of the following statements regarding to rescue a child CPR is correct? A: a compression to ventilation ratio of 15:2 should be delivered without pauses in compressions to deliver ventilations. B: the chest should be compressed with one hand and a compression to ventilation ratio of 30:2 should be delivered. C: compress the chest with one or two hands to a depth that is equal to 1/3 the diameter of the chest. D: the chest should not be allowed to fully recoil in between compressions as this may impair venous return. Think of the answer before the reveal. The answer is, you selected C. This is correct. Reason: when performing to rescue or CPR on a child 1 year of age to the onset of puberty 12 to 14 years of age, the chest should be compressed with one or two hands depending on the size of the child, and a compression to ventilation ratio of 15:2 should be delivered. It is important to compress the chest to an adequate depth 1/3 the anterior-posterior diameter of the chest, about 1/2 in the child. The chest should be allowed to fully recoil in between compressions in order to maximize venous return to the heart. If an advanced airway device, i.e., ET tube, multilumen airway, supraglottic airway is not in place, two rescuers should deliver cycles of CPR. The compressor should pause briefly so the ventilator can deliver 2 breaths. A compression to ventilation ratio of 30:2 is used for one rescuer child CPR. After an advanced airway device has been inserted, cycles of CPR should not be performed. Compressions should be continuous at a rate of at least 100/min and ventilations should be delivered at a rate of 8 to 10 breaths/min, 1 breath every 6 to 8 seconds. Flashcard 196. Your assessment of a mother in labor reveals that a fetal limb is protruding from the vagina. Management of this situation should include positioning the mother with her hips elevated, administering high-flow oxygen, and providing transport. B: applying gentle traction to the protruding limb to remove pressure of the fetus from the umbilical cord. C: positioning the mother in a semi-Fowler's position, administering oxygen, and providing transport. D: giving the mother 100% oxygen and attempting to manipulate the protruding limb so that delivery can occur. Think of the answer before the reveal. The answer is, the correct answer is A. Reason: limb presentations represent a dire emergency for the newborn and do not spontaneously deliver in the field. You should position the mother in a manner so that her hips are elevated in an attempt to slide the infant slightly back into the birth canal and remove pressure from the umbilical cord. Administer high-flow oxygen to the mother. Cover the protruding limb with a sterile sheet or any clean sheet if a sterile sheet is not available, and transport immediately. Do not pull on the protruding limb as this may cause injury to the newborn. Flashcard 197. Following delivery of a newborn and placenta, you note that the mother has moderate vaginal bleeding. The mother is conscious and alert and her vital signs are stable. Treatment for her should include A: treating her for shock and providing rapid transport. B: carefully packing the vagina with sterile dressings. C: administering oxygen and massaging the uterus. D: massaging the uterus if signs of shock develop. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: postpartum bleeding is most effectively controlled by massaging the fundus top of the uterus. Uterine massage stimulates the pituitary gland to secrete a hormone called oxytocin, which constricts the blood vessels in the uterus and helps stop the bleeding. Do not wait for signs of shock to develop before performing uterine massage. The goal is to control the postpartum bleeding in order to prevent shock. Administer supplemental oxygen as needed, begin transport, and monitor her for signs of shock, i.e., tachycardia, pallor, diaphoresis, tachypnea en route. Vaginal bleeding is never treated by placing anything inside the vagina. This action increases the risk of maternal infection. Flashcard 198. You are assessing a 5-year-old boy with major trauma. His blood pressure is 70/48 mmHg and his pulse rate is 140 beats/min and weak. The child's blood pressure, A: is appropriate based on his age. B: suggests increased intracranial pressure. C: indicates decompensated shock. D: reflects adequate compensation. Think of the answer before the reveal. The answer is: the correct answer is C. Reason: the low normal systolic blood pressure SBP for a child between 1 and 10 years of age is calculated by multiplying his or her age in years by 2 and adding 70. Using this formula, the low normal SBP for a 5-year-old child is 80 mmHg. Anything less indicates hypotension. Therefore, a SBP of 70 mmHg in a 5-year-old child, especially in the context of major trauma, indicates decompensated shock. Patients with increased intracranial pressure are typically hypertensive, not hypotensive. Flashcard 199. The main reason why small children should ride in the back seat of a vehicle is because A: their legs are highly prone to injury from striking the dashboard. B: they can experience severe injury or death if the airbag deploys. C: they are much less likely to be ejected from the vehicle. D: the back of the front seat will provide a cushion during a crash. Think of the answer before the reveal. The answer is: you selected B. This is correct. Reason: children under 12 years of age should ride in the back seat of a vehicle, preferably in the middle, and restrained in a device that is appropriate for their size. Merely placing the child in the back seat does not reduce the risk of ejection. The child must be properly restrained. Young children, especially those restrained in a child safety seat, may be critically injured or killed by airbags if they are riding in the front passenger seat of a car. This occurs because the child safety seat positions the child too close to the airbag. The force of the deploying airbag may cause severe head and spinal trauma. Flashcard 200. A 4-year-old boy ingested an unknown quantity of drain cleaner. He is alert, has a patent airway, and has adequate breathing. You should: A: administer 1 g/kg of activated charcoal. B: give 15 ml of ipecac and contact medical control. C: contact poison control and give him oxygen. D: give oxygen and perform a head-to-toe exam. Think of the answer before the reveal. The answer is: you selected C. This is correct. Reason: once you determine that a poisoning has occurred and have identified the poison, you should contact the Poison Control Center at once. 800-222-1222. Give the patient high-flow oxygen or assist his or her ventilations if necessary. Induction of vomiting with syrup of ipecac is no longer recommended because of the risk of aspiration. Activated charcoal is contraindicated in patients who have ingested a corrosive substance, for example, drain cleaner, or a petroleum product, for example, gasoline, motor oil. A head-to-toe exam is not practical in this situation, at least initially. Follow the directions given to you by the Poison Control Center, transport the child without delay, and monitor his condition en route.